Good evening, everyone. So, after a long time, we have gathered here again to continue our series on the organon. So, the last time we were doing or we were talking about the local diseases, the diseases which appear on the skin, why they appear, how they appear, and what should not be done in such cases, along with the homeopathic treatment which we have to do. We were talking about that. So today we will continue more about the same thing for few more aphorisms. Just a minute. Yes. So we will continue from, we have done up till aphorism 198, and we will continue from there with the aphorism 199, and we'll try to complete it till 205, where there will be this introduction to the miasms, uh, how the miasms they basically play a role in the continuity of the chronic diseases. We will talk about that thing also. Although we have talked about this thing in our previous lecture on Sora, we have talked in detail that how the Sora it basically progresses, how it starts taking the roots into a person, and how it makes the person sick, and how it is basically a root to the chronic diseases. We'll talk in brief about that today. So aphorism 199. If the remedy perfectly homeopathic to the disease had not yet been discovered, at the time when the local symptoms were destroyed by a corrosive or desiccative external remedy or by the knife, then the case becomes much more difficult on the account of the too indefinite, uncharacteristic, and inconstant appearance of the remaining symptoms. So, Dr. Henneman, he's trying to tell us that if we have not yet found a homeopathic remedy, like if the local symptoms they were destroyed by some kind of local treatment or some kind of desiccation or some kind of the removal was done by the knife or some kind of operation, if the local symptoms are disappeared and the homeopathic remedy is not find the perfect homeopathic remedy, then it is become this kind of case, it becomes very difficult. Then the case becomes much more difficult on account of the too indefinite uncharacteristic symptoms. As we have done understood it before and discussed it before also, that in such cases, the cases where the disease is local, where the disease is on the external sphere of the body, on the skin, that appearance or the characteristic of the lesion or the eruption, that is what basically defines which homeopathic remedy has to be given. So that symptom in itself is very important. So when that symptom is removed, because in most of the skin diseases, like if you see, if you have some patients who have some skin troubles from a very, very long time, like that skin trouble, it came as an initial disease when the whole disease started, and it has never gone. So in such cases, although they have been taking too much of treatment, the symptom is still there, because the body basically the vital force it tries to keep the disease in a more external part so that the disease does not develop internally. That is the way, that is a defense of the vital force, where the vital force is of more resistance, is more strong, it will try to keep it in a more outer part. So in those cases, in those patients, you will also see that there is very less internal diseases or internal symptoms which have developed. You will rarely see such cases that they have developed some kind of diabetes or hypertension or some kind of internal ulcers or some other kind of structural diseases inside. You will very rarely see in them. The people who have been having skin disease from beginning and they still have, that it was not treated. It was not treated properly. It was, it was not suppressed by the local. You will see that their vital force has a strong resistance, that it has not let the disease travel inside. Dr. Henneman will speak about it in coming aphorisms. But when it is gone, like if the vital force cannot produce much resistance, it gives into such kind of treatment and it is gone, then we are not left with anything, because homeopathic prescription basically depends upon the characteristics. Anything which makes the disease individual, that is where we have our remedies basically hidden. We have to find our remedy from that part. So when that characteristic part, which in such cases is in a form of local symptom, the kind of like, day before yesterday I had a patient, the lesions or the eruptions, they were of purplish kind. The color was purplish, the bluish reddish color was there. So that is a characteristic thing. If it would have been treated with some kind of local ointment and I would not have seen it, or it has been gone, then we will not be able to give a perfectly homeopathic remedy which can cure this thing. So similarly, in those cases where the homeopathic remedy was not found and the symptoms, they were destroyed by such kind of treatment, then the case becomes very, very difficult to prescribe upon, because there are no uncharacteristic symptoms. And the symptoms, even if some symptoms are there, they are of very inconstant appearance. They come sometimes, they are not there sometimes. So for what might have contributed most to determine the selection of the most suitable remedy and its internal employment until the disease, everywhere in the cases, in these aphorisms, where Dr. Hahnemann is talking about the local diseases, the diseases which come on the skin, he makes sure to tell the reader, to tell the physicians how the medicine is to be employed, the internal employment. The medicine has to be given internally, not externally, everywhere. So he has continuously told in the previous aphorisms not to use any kind of treatment externally. Why? He has told us. And on the contrary, he has told us in all the other aphorisms to give an internal remedy, which is most suitable, which is most homeopathic. And its internal employment until the disease have been completely annihilated, namely the external principal symptom. So this skin symptom, this local symptom, it was the principal symptom. It was the main symptom from where the entry to the case was done, from where we would have to make sure that which remedy is to be given. So when that principal symptom is destroyed, it becomes very difficult to prescribe in that case. So in such cases, then we have to wait for a long time for again a new set of symptoms to come up, so that we can decide upon our remedy. But during that time, during those 6 months, during that 1 year, 2 years, the disease has progressed a lot. So basically we have lost our chance to cure the patient where it can be cured very quickly, and we have given the time to the patient for the disease to develop. So aphorism 200, had it still been present to guide the internal treatment, if though a symptom was still present, if it was not destroyed, if it was not, removed by some kind of operation or some kind of, mechanical means, if that symptom would have been there, had it still been present to guide the internal treatment, if it had been present to search for the homeopathic remedy for the whole disease might have been discovered. So if that symptom would have been present and we would have discovered the homeopathic remedy, and has that been found, the persistence of the local affection during its internal employment would have shown that the cure was not yet completed. So if we have given a homeopathic remedy, if that symptom, now how that symptom guides us? It guides us in two ways. The one is to search for a homeopathic remedy. it becomes a characteristic symptom which helps us to find a homeopathic remedy. And in second, when the local affection is not going away by giving an internal medicine, when we are giving an internal treatment and the local affection is not going away, it is persisting, then it shows that the cure is not yet completed. So in second instance, it also tells us the persistence of the local affection, the persistence of the local eruption or local malady, that the internal disease is still there. If we apply something on it and it disappears, we are not sure that the internal disease is gone or not, whether the sora has been cured or not, because then it will show in some other kind of symptoms. So even the presence of such a symptom, if it has been not cured, it can also tell us that the internal employment of the remedy, whichever we have given, it has not yet completely cured the patient. But were it cured, and if it is cured by the homeopathic remedy, by the internal treatment, on its seat, this would be a convincing proof that the disease was completely eradicated. Because we have not applied anything on it. It came from the internal disease, and when it goes away, that can be a convincing proof that the internal disease has also gone away. Because the internal disease was the causation for the occurrence of it and for the persistence of it. It occurred because of that internal infection and it persisted because of that internal infection. So when it is gone, it becomes a convincing proof that the disease is completely eradicated and the desired recovery from the entire disease was fully accomplished. An inestimable, indispensable advantage. So even if it is not getting cured, it gives us an advantage to know whether our remedy is right and wrong, towards which direction the cure is going on. So aphorism 201. It is evident that man's vital force, when encumbered with a chronic disease, which it is unable to overcome by its own powers. We have already established in the previous aphorisms where Dr. Hahnemann tells us about the vital force. That vital force, when in a healthy state, it provides health, a harmony to the body. But when it is weakened by some chronic disease, by some kind of acute disease, then it does not have the power to overcome it. It cannot overcome it, it cannot cure it. It will always need a physician which can help it to cure the patient. But on its own, whenever it is affected by some kind of chronic diseases, it is not able to overcome it. So the same thing is told here, that it is evident that man's vital force, when encumbered with a chronic disease which it is unable to overcome by its own powers, adopts the plan of developing a local melody on some external part. That is why in any kind of miasmatic start of a chronic disease, the first symptom is always on the skin. In sora, that itch, it comes on the skin. In psychosis, that gonorrhea, it comes on the skin. And in syphilis, the chancre, the ulcer, it comes on the skin. Because whenever some chronic disease starts because of the miasm, because of the internal disease, the first, when the vital force is not able to repel that disease and that disease is becoming stronger, the first defense which the vital force produces is that it adopts the plan of developing a local malady. There's a plan. There's a genetic plan inside the body that whenever it is attacked by a disease, the first symptom, they will appear locally on the skin. That is how the vital force basically intercepts the development of the disease. Solely for this object, that by making and keeping in a diseased state this part, which is not indispensable to human life. Skin is, it is an important organ, very important organ, but it is not indispensable to the human life. It is not that whether if the disease comes on this part, that something danger or dangerous can happen to human life. Okay, it is not like this. We have more vital organs which are inside the body. So this is the most outer part. So the body, sorry, the vital force and the body, it basically tries to keep the this disease on the most outer part of the body, which otherwise threatens to destroy the vital organs. But if the vital force has not done what it is meant to be done, then the same disease can go more deeper and can threaten and destroy the vital organs on which our life depends, which are very vital for our life, and to deprive the patient of life, and that it may thereby, so to speak, transfer the internal disease to the vicarious local affection and, as it were, draw it thither. So what is this vital force? What does it do when it is attacked by the chronic miasms? That it tries to keep the disease on the external part, on the external this thing, because this disease, if it is let loose, if there is no control or no pressure is exerted by the vital force against it, against the attack, then it may destroy the life of the patient. It may become so dangerous that it can affect the vital organs and the life can be taken away from the patient. So the best way, according to the intelligence of the vital force, is that to keep it on the local part, to keep it in the outer part and just let it be there. That is why I was telling that there are many, you will see many patients. I have seen many patients, who are suffering from skin disease from past 30 years, 40 years of their life, 20 years of their life, and very few symptoms have developed inside. Although the outer one, the skin problem is not gone, like someone suffering from psoriasis, eczema, dermatitis from a long time. So their body, the defense has been so much persistent that it has not let it break through the skin. Although the new parts of the skin may have become, affected, like it started from elbow, then it went on to the skin, then to the chest, then to the back. So that shows that that the disease has increased. But although with the disease increase of the disease, the vital force has kept it on the external part of the skin. Just think, if it would have spread into the internal part, how would it have spread? With how much force, with how much energy it would have spread inside if it was not kept outside on the local part. So the presence of the local affection thus silences for a time the internal disease. So this presence of local affection, what it does is it silences the internal disease. The progression of the internal disease is basically halted. So without being able either to cure it or to diminish it materially. But the vital force, it does not have the power to cure it or to reduce it or to diminish it. The local affection, however, is never anything else than a part of the general disease. Like we were discussing last time also, when we had this thing, we had this class, that the local affection, the skin diseases, it is mostly sensed as something which does not belong to the internal part. It is something external. If we remove it, it is gone. Usually it is think of like that. But we have to understand, as a homeopath, as a physician, that it is not some different thing and should not be treated differently. It is the part of the whole. It is a small sign and symptom which the body is showing that it has started getting diseased. So we should not take it in a lighter way. We should give it very importance, because this is the first barrier. If it goes past that barrier, then it will start developing internally. So the local affection, however, is never anything else than a part of the general disease, but a part of it increased all in one direction by the organic vital force. So the vital force, what it has done, that whatever the increase in disease has happened, it has thrown it out on the external part and transferred to a less dangerous external part of the body in order to allay the internal ailment. So to decrease the internal ailment, it has just thrown it out on the external part. But as has been said, by this local symptom, that silences the internal disease. So that is why we say that suppression of some skin disease is a very dangerous thing. And in such cases where the suppression has been done and then some disease has progressed, and when you give a homeopathic remedy and that disease started getting better and the reappearance of some skin symptoms come, that is a very good thing. It is a very good sign. Today there's this lady who has been taking this treatment from me from past 1.5 year. She's a doctor herself, and she has been taking this medication for the gastric ulcers. She has a very strong dyspepsia and gastric ulcers, some problems with her urinary bladder, some problems with the menstruation, and another many small problems she had. And she has been getting better from past 1 year. She has been getting better. Some symptoms have gone, some old symptoms have come up. So today she sent me the picture that, doctor, I have started getting this eruptions and acne on my face. So I again asked that, like previously, did you used to have? She said that my whole problem started with this thing. That in my teenage, when this thing started, and I started taking treatment for it, then I started feeling this, this dyspepsia and my disturbance in menstruation. Said that at that time it used to be very bad, so I had to take many kind of treatments for it. And after that, I have started feeling that all these problems which I had has started. So when you see such cases and you go through the organon, you see the similarity. You see the same thing which is written happening in front of you. That yes, the patient has told this thing that, and we have seen, the patient has seen, we have seen, and then when they start getting better, the reappearance comes, the same kind of symptom coming up mean that it has never gone. It was never gone. It was always there. It was just in a suppressed state. The disease had just moved from a more superficial organ to more deeper organs. And when a right dose was given, it has come from a more deeper organ to the original state where it started. But as has been said, by this local symptom that silences the internal disease, so far from anything being gained by the vital force towards diminishing or curing the whole malady, the internal disease, on the contrary, continues in spite of it, gradually to increase, and nature is constrained to enlarge and aggravate the local symptom always more and more. So the same thing which we were talking about, that a local symptom, it keeps on getting enlarged and aggravated. It started from the elbow, went to the whole arm, then to the chest, then to the other arm, to the back, because the nature is trying to constrain the disease from going inside. So what it is doing is that increasing the symptoms more on the outer part, because the internal disease is also increasing. It is not curing, it is not diminishing. Although the vital force has established a defense, a buffer, that this disease should not come inside, but on the outer also it is increasing. It is becoming enlarged and aggravated, the local symptom always more and more, in order that it may still suffice as a substitute for the increased internal disease and may still keep it under. So it becomes a defense of the body, it becomes a defense of the vital force to keep the disease outside, although the whole body starts getting covered by that eczema, by that ulcers, or by any kind of local symptom which is being produced. But it does not let it come to the inside. That is a way how the body, how the vital force, it keeps a check that the internal organs or the inside of the body is protected. So old ulcers on the legs get worse as long as the internal sora is uncured. So here we have to understand that what is to be cured now in this case, in such cases, whether the local symptom is just a local symptom, the diseases, this eczema, this psoriasis, or any other kind of diseases which are persistent and from a long time, are they just local and can they be cured locally, or there is something else to it? So as a physician, we have to understand that it is the internal disease which is uncured and increasing. So as long as that is not cured, the outer symptoms of it are they are never going to go. And even if they go, they may go into more dangerous states. They can affect more vital organs then. The chancre enlarges as long as the internal syphilis remains uncured, just as general internal disease continues to increase as time goes on. So as the time goes on, the internal disease it continues to increase, the local symptom they will keep on increasing. So footnote to aphorism 201, the issues of the old school practitioners do something similar. As artificial ulcers on external parts, they silence some internal chronic disease. So in old school practitioners, the way the practice was at that time of Dr. Hahnemann, the physicians, the doctors, they used to produce some kind of artificial ulcers to let the blood out. So for that time when they used to produce that thing, some internal irritation will be worn out. So the patient will feel the relief in some kind of internal irritation, internal sensitivities, whichever they had at that time. So at that time it was thought as a treatment for such kind of diseases, but it was not a treatment. Artificially, a disease was produced on the external part, on the local part. So the body had to respond by decreasing the internal disease and focusing on the external one. But because it was not a natural thing, it was not a natural way of the vital force. So what will happen is that they will silence some internal chronic disease, but only for a very short time without being able to cure them. They could not cure it. So it was just again a suppression of the internal disease in a vice versa way. But on the other hand, they weaken and destroy the general health by doing this, because whenever you are trying to suppress something, go out of the way, go out of the natural way, what we will do is that we will weaken the patient more and more. So by that bloodletting, by making that artificial ulcer, the patient would become more weak, and it will destroy the general health much more than is done by the most of the metastasis affected by the instinctive vital force. So that will basically destroy the health or weaken the patient in a more faster way than the vital force could have done. So if the old school physician should now destroy the local symptom by the topical application of external remedies, under the belief that he thereby cures the whole disease, nature makes up for its loss by rousing the internal malady and the other symptom that previously existed in a latent state side by side with the local affection. Now, if the physician he somehow destroys this local symptom, he is somehow able to do this thing with some kind of external remedies, with some kind of ointments, with some kind of something which is put on the local symptom from the external way. What happens is that this is a loss to the nature. Dr. Hahnemann uses that nature makes up for its loss. That it is a loss to the nature. Why it is a loss? Although the vital force or the nature cannot fight against the disease on its own, but still it has provided a very good defense so that it remains to one single part. So when we are trying to basically uh, break through that barrier, vital force has formed a barrier that okay, there is a disease but it will remain in the external part. I will not let it I will not allow it to come inside to the internal this thing. But when we are helping the disease by applying something local, by applying some external remedy to break that barrier, so it is a loss for the nature, it is a loss for the vital force, because otherwise the disease might not have been able to break that barrier, but the physician helped to break that barrier. And what has nature has to do is it has to make up for that loss. How it makes up for that loss is by rousing the internal mind. It has to increase the disease inside. That is the only way then. It has to put it in some other organ, because now it has come inside. So as aphorism 74 tells us, that nature of the vital force is always trying to maintain the life, so it will put into some organ, one of the organs, and try to keep it there until we do something else, until the uh, treatment again is given in a wrong way. So it will basically start increasing the symptoms which were latent, and now side by side with the local affection, it will start increasing that also. The local affection will also remain, and some symptom will start increasing. That is to say, she increases the internal disease. So the internal disease will start increasing. So the more we apply for this external symptoms, the more we apply some external remedies, the more the local affection will become better and the internal disease will become increased. So when this occurs, it is usual to say, though incorrectly, that the local affection has been driven back into the system. This is suppression. The word uses driven back into the system. So the local affection has been driven back into the system. So the body had put it outside. Now with the local or the external remedies, we have driven it back into the system or upon the nerves by the external remedies. So this is the aphorism which basically tells us these are the about the suppression from the layer of the skin and how it affects our internal disease or the internal body. So aphorism 203, every external treatment of such local symptoms. That is why we give a very, like when we are seeing the patients, we always tell them that be very careful. If something comes upon the skin after the treatment, don't apply anything on it. Don't apply anything which can basically drive it again back inside. And we have seen in many patients who have used something topical, local on the skin, and their older symptom they came back. The symptoms which are getting better. Even we have this one case in Thailand. The a male patient who has this problem with the hearing. His hearing started becoming better. He applied something on the skin. I think I don't know. He had something. Maybe he applied some balm or some this local painkillers or something he applied, and his hearing started diminishing again. So that also shows us a direct link between the skin and the nerves, and that is what is told by Dr. Hahnemann also here, you know that driven back into the system or upon the nerves by the external remedies. There's a direct relation, and you can see that in patient, that when this kind of problems they start getting better, something will come upon the topical part, upon the external part. And if that is again, we do something again bad to it, we suppress it, it will go again to the internal part, or the symptoms will start increasing again. So it is very important to tell the patients beforehand that if you have anything, don't do anything about it. You can talk to us, you can come, you can show, but don't do anything about it. That is why, because many times that when we are seeing the patients, some doctors they are that, why you give so much importance to this, and the local some symptoms if they come up, why in every follow up you ask about them, that did you had any kind of some symptoms on the skin or not. This is why, this is the whole reason. So every external treatment of such local symptoms, the object of which is to remove them from the surface of the body, whilst the internal miasmatic disease is left uncured. So any kind of external treatment, any kind of treatment, whether it is done by some kind of homeopathic remedy or so-called homeopathic medicines, because nowadays many the stores or the pharmaceutical companies, they are selling some arnica, some chamomilla to apply on the body, many kind of skin routines. I have seen recently that in many kind of skin routines, they have started using the this mother tinctures of homeopathy medicines to create some kind of creams. So any kind of that is why Dr. Hahnemann has said that every external treatment, any kind of, if you are using calendula, if you are using anything for external treatment of such local symptoms, if we are doing something, the object of which is to remove them from the surface of body, and the objective of such a treatment is to remove that local symptom, whilst the internal miasmatic disease is left uncured, and there is no focus on the internal miasmatic disease, and it is left uncured, incurred, because no internal anti-miasmatic medicine or any homeopathic medicine has been given to that patient, as for instance driving of the skin, the psoric eruption by all sorts of ointments, burning away the chancre by caustics, and destroying the condylomata on their seat by the knife, the ligature or the actual cautery. This pernicious external mode of treatment, hitherto so universally practiced, has been the most prolific source of all innumerable named or unnamed chronic maladies under which mankind groans. So Dr. Hahnemann is saying that all those diseases which have been named or even not unnamed, we don't even know about those diseases which are happening, we have not named them, under which the whole mankind is suffering. The reason, the source for that is because we have been curing the diseases from the external part, the psoric eruption by some kind of ointments, or some chancre by burning it by the caustics, or we are destroying the condylomata or the warts or by the knife or the cautery or the ligature. And this has become, this kind of dangerous mode of treatment has become the source for all the diseases which are developing inside the body, all the chronic diseases. It is one of the most criminal procedures the medical world can be guilty of, and yet it has hitherto been the one generally adopted. Dr. Hahnemann is saying that it is happening in front of us, that when we are doing such treatment, the internal symptoms they start developing. We can see that the symptoms they have become more profound after such kind of treatments. But still, it is a generally adopted treatment. Still, it is the thing which is done and taught from the professional chairs as the only one. And from the professional chairs, it is taught that this is the only way. This is the only treatment. So Dr. Hahnemann calls it the most criminal procedure. Why criminal? Because we are pushing someone towards a more hastened death. Death is going to come. One is the person will die naturally, maybe in a healthy stage, maybe in a less diseased state. Okay? But when we are hastening the process, we are making the process more rapid by some kind of procedures, then definitely it should be called criminal. So he's saying that this is most of the criminal, one of the most criminal procedures the medical world can be guilty of. So the whole medical world has to come up, see what is happening in front of our eyes. Okay, maybe, although it is not, but maybe the aphorism is wrong. But we can see what is happening in front of our eyes. And when we see more faithfully in the truth what is happening, all these aphorisms will come true. You will see that every word which is written here is a very truthful thing, and this is happening. It happens in this way. So footnote to aphorism 203, for any medicine that might at the same time be given internally, served, but to aggravate the malady, as these remedies possessed no specific kind of curing the whole disease. So now many medicines are given internally, but they will aggravate the remedy if they do not have the power to cure the whole disease, if they are not given in a homeopathic way. Because many times, when some of the physicians, they started observing this thing. They started giving the same medicine internally. Sulfur applied externally, okay, no, we will give sulfur internally. But if it is not homeopathic, then it will again aggravate the disease. If it is not given in a homeopathic way, because as these remedies possessed no specific power of curing the whole disease, but assailed the organism, weakened it, and inflicted on it, in addition, other chronic medicinal diseases. For example, a patient is suffering from fungal infection on the skin, and some antifungals are given inside. They cannot cure the whole malady. So that will all again aggravate the disease. Because we have to understand, we have to cure that internal disease which is going on in the whole body, not on some local part, not on some toenails, not on some foot, not on the hand, because hand is not the man. And the medicine should be given for the man, not for the hand, not for some local part, not for the skin. So aphorism 204. If we deduct all the chronic affections, ailments and diseases that depend on a persistent unhealthy mode of living. So Dr. Haniman says, if we just deduct, if we remove, if we just keep them aside, all those chronic affections, which basically depend from the unhealthy mode of living, the way we are living. It is more given in the aphorism 77. We can refer to that thing also. So all those diseases which are dependent on the unhealthy mode of living, as also those innumerable medicinal maladies, and all the diseases which are basically produced by the medicines. Aphorism 74. Okay, the medical dyscrasia, if we just keep that aside, and all the diseases which are basically produced by the unhealthy mode of living, caused by the irrational, persistent, harassing, and pernicious treatment of diseases, often only of trivial character, by a physician of the old school. So all those, if diseases are kept aside, the medicinal diseases and the diseases which are dependent on the unhealthy mode of living, all the remainder, whatever the remainder is there, without exception, result from the development of these three chronic miasms. So all the diseases which are remaining, they all develop from these three chronic miasms. The internal syphilis, internal psychosis, but chiefly and in infinitely greater proportion, internal sora. Each of which was already in possession of the whole organism and had penetrated it in all directions before the appearance of the primary vicarious local symptom of each of them. So when the primary symptom comes, the symptom on the local part comes, on the skin comes, before that these miasms have already be possessed the whole organism. They have already seeped in, they have already penetrated in all the directions, and long after that penetration, long after that possession, the primary local symptom comes. Now, how we can understand whether they have penetrated, that is a very long discussion. I will not go into that. I have already taken this one class on the sora and the miasms. So I don't know if we have put it on online or not. I will talk with Dr. Rishabh. And I have also spoken about sora in Thailand and Brazil also in the different workshops. So that is also a very detailed thing. So maybe if we can go about it on some other day, but we have to understand that this local symptom has come long after that seeping, long after that penetration. And in the case of sora, the scabious eruption; in syphilis, the chancre or the bubo; and in psychosis, the condylomata. So these are the three basic local eruptions which come in these three basic miasms. There can be different kinds to that also again, but these are the three basic eruptions which come that prevented their outburst. So this local symptom basically prevented their outburst, although it has seeped in, although it has possessed the whole organism and penetrated in all directions. But this local symptom has basically prevented the outburst, and these chronic miasmatic diseases, if deprived of their local symptom, are inevitably destined by mighty nature sooner or later to become developed. And if this local symptom is taken away, it is maltreated, it is suppressed, then that it is inevitable that we can stop the development of the miasms and to burst forth and thereby propagate all the nameless misery, the incredible number of chronic diseases which have plagued mankind for hundreds and thousands of years. So this is not something new. This is not something new which has happened to the humankind for the first time. Aphorism 81, we can go there and we can again read it. Aphorism 81, that it has passed on from generation to generations, from thousands of years, none of which would so frequently have come into existence had physicians striven in a rational manner to cure radically and to extinguish in organism these three miasms. So Dr. Hahnemann is also saying that if physicians have striven in a rational manner, if they have uh, this understood the relation between this local symptom and the whole disease, the miasmatic disease, then the organism, or from thousands of years, the humanity would not have striven, would not have, been succumbed to these kind of diseases. And if they would have worked to extinguish in organism these three miasms by internal homeopathic medicine suited for each of them, without employing topical remedies for their external symptoms. So he's saying that we would not have seen such kind of development of these miasms if some homeopathic medicine suited for them was given internally and the external symptoms were not destroyed by some topical remedies. So we would not have we would not have seen this kind of development of diseases which we are seeing today. Aphorism 205, the homeopathic physician. So for a homeopathic physician, now this is a pointer that the homeopathic physician never treats one of these primary symptoms of chronic miasms. So like I told you, that homeopathic physician does not cure the skin. He does not cure the ulcer. He does not cure the scabies or the condylomata. His focus should not be there, because I have spoken already about this thing, that the way you are going to cure the patient or treat the patient, it depends completely on your focus. What are we have to ask ourselves, what I am going to cure in this patient. This is a practice which we have to come up with, that okay, this is the whole case history. After taking the case history, now whether I will focus on his diabetes or hypertension or his ulcers or his psoriasis, or should I focus on him? In my follow-up, should I ask about him or should I ask about the primary symptoms or the secondary symptoms of the miasm? So in 205, Dr. Hahnemann very clearly says the homeopathic physician never treats one of these primary symptoms of chronic miasms, nor yet one of their secondary affections that result from their further development. So after the local disease is suppressed or maltreated, the symptoms which develop afterward, they are called as the secondary symptoms, secondary affections. The primary symptoms are the local disease. So we are not even curing the local disease, the primary symptom or the secondary symptoms. That should be our approach. The whole organon is to set the approach of the physician. That is why the physicians, they become successful if they can go with the approach, and that is why the physicians, they basically somewhere do not get the desired results, because the approach has not been set. So we have to set our approach, we have to set our focus, that as a homeopathic physician, what I should do. So I will not go after those primary symptoms. I am not going to treat the secondary symptoms by local remedies, neither by those external agents that act dynamically, nor yet by those that act mechanically. So I am not going to use any local agents, any external agents, any mechanical agents, but he cures in cases where the one or the other appears, where the primary or secondary symptoms they appear. He cures only the great miasm on which they depend, whereupon its primary and also the secondary symptoms disappear spontaneously. So his focus is to cure that miasm, cure the whole process which is going on inside the body, because he knows that the primary and the secondary symptoms basically depend on this great miasm. So my focus is to cure that miasm. Once that miasm is cured, once it is gone, everything which is dependent on it will be gone. But as this was not the mode pursued by the old school practitioners who preceded him in the treatment of the case, the homeopathic physician generally alas finds that the primary symptoms have already been destroyed by them by the means of external remedies. So this happens with the homeopaths most of the time, that the patient, they come in more advanced stages of the chronic diseases. They are not coming when it started at that local symptom part. And many, they have forgotten about it also. Many patients, they have forgotten about, if someone used to have some boils or eruptions as a child, they have all completely forgotten until and unless they reappear. Then it strikes to them, like the patient I told you, that when the acne they came back, then it struck her. Otherwise, in the history, in her past diseases, she has not mentioned it. Then it struck her that, okay, this same kind of symptoms I used to have. So for a homeopathic physician, that is why Dr. Hahnemann has written the word alas, that, unfortunately what happens is that those primary symptoms have been already been destroyed by means of external remedies, and that he has now to do more with the secondary ones. That is, the affections resulting from the breaking forth and development of these inherent miasms, but especially with the chronic diseases evolved from internal sora. So all these symptoms which are developed after that suppression, after the destruction of the local symptom, the destruction of the primary symptoms, and we have to deal with that, the internal treatment of which, as far as a single physician can elucidate it by many years of reflection, observation, and experience, I have endeavored to point out in my work on chronic diseases, to which I must refer the reader. So how we have to go through with it? He's saying that I have written in the chronic diseases, I have put many years to it, how to understand, how to, work with that thing, with those secondary or tertiary symptoms of the development of these miasms. So footnote to aphorism 2054, I cannot therefore advise, for the same reason which have been going on, that he's saying that I cannot therefore advise. I will never advise, and I cannot advise, for instance, the local extirpation of the so-called cancer of the lips and face by means of the arsenical remedy of Frere Cosme. He's saying that I will never advise that even if there is cancer on the lips or the face, that it should be extirpated, removed locally by some remedy which might be commonly given at that time, that Frere Cosme. Not only because it is excessively painful, it is very painful and often fails, but more for this reason, because if this dynamic remedy should indeed succeed in freeing the affected part of the body from the malignant ulcer locally, the basic malady is thereby not diminished in the slightest. The preserving vital force is therefore necessitated to transfer the field of operation of the great internal malady to some more important part. So he says that even in the case of some kind of cancer which is external on the squamous epithelium, some lips of the face or the face, he said that I will not advise to remove that thing with some kind of remedy, with some kind of mechanical means. He said, no, although that is painful and it often fails also. We have seen many cases of the squamous cell epitheliomas which have failed after the removal. I have seen many with that problem when it was on the tongue or on the face, that they have failed. Um, at least the cases which I have seen, uh, it always metastasized, it always increased. So he's saying that the reason for that is that why I will not advise is for the same reason. Because once, although it is very dangerous thing, although it is a more ulcerative thing, but even if you will remove the vital force, as is basically the vital force is a programmed thing. So according to its program, whenever this will be removed, it has to basically transfer the field of operation internally, as it does in every case of metaschematism. There is a very big schematic, very big programming to it, and because of that schematism, it will basically move the disease inside, and the consequences: blindness, deafness, insanity, suffocative asthma, dropsy, apoplexy, etc. So the diseases will come more dangerously in a more violent manner. But this ambiguous local liberation of the part from the malignant ulcer, that is why many times when some patients they come to me for advice, when they have accidentally found some kind of tumor, some kind of this thing, although even if they don't want to take the homeopathic remedy, my advice, if there are no violent symptoms or this thing, some kind of this thing, the advice is to just wait, because you have found it accidentally. So you didn't had any more important symptoms or any symptom which showed this thing, some kind of fibroids or fibroadenomas which were found, because once you remove it, although in an anticipatory manner, it will start going somewhere. That is a programmed thing in the body. We have to understand the programming of the body. It is the biology. It is programmed in our genes, the way the vital force has to work. So in those cases where the ulcer has not yet attained any great size, and when the vital force is still very energetic, but it is just in such a state of things that the complete internal cure of the whole original disease is also still practicable. So saying that with the homeopathic medicines, even in such cases, the internal cure is still practicable. We must proceed with that thing. The result is same when the cancer of the face or breast is removed by the knife alone, and when cystic tumors are enucleated. When some kind of tumors they are removed, or some cancer of the breast or face is removed, the same result will come. Something worse ensues, or at any rate death is hastened. The problem is, it is not that I have, like recently I had a case of cancer with, there was metastasis of the cancer. So because they have been taking medicine from the family, other members of the family, they were taking medicine from me for a long time, and they have get better in many kind of diseases, from many kind of diseases. So they had this faith in me. So when they came for the advice, I told them according to this thing, because we have seen practically, I have seen in some of my relatives also this thing happening. In many cases when you suddenly find out about the cancer and some kind of treatment is given, the patient becomes weak very rapidly. I have seen patients who went to the hospital walking on their legs, but they never came back. They became so weak. So here also Dr. Hahnemann is saying that even that rate of death, it becomes hastened. If a patient with metastasis had only 6 months, with the treatment he sometimes only lives for 20 days, 30 days at the max, which he could have lived for 6 months. Like I told you, death is something which is inevitably going to come. When a person was born, on the same day, it was very much, written that he's going to die someday. So death is inevitable. We cannot make anyone immortal with medications. Yes, but what we can do is we can basically decrease the speed of death, decrease the speed at which a patient is going toward. We can give a more quality to the life. We can make sure that the patient does not suffer much, in such cases does not suffer much from the pains, from some kind of that he does not become dependent upon others. We can do such things. And I have seen many patients, especially in the metastasis of cancer, like the same case which I was telling you about, that the family, the recently he died. He was diagnosed around 1.5 year back with the CA of spine, and which was metastasized to lungs also, and to the abdominal part, the peritoneal cavity. So the attendants, the son of the patient was also 76, 77 years old. So the son, he told me that, doctor, I have seen many patients of cancer in our relatives, and I was very afraid when I got to know that my father is suffering from the cancer. I was very afraid that he will suffer a lot, because I have seen patients suffering, the pains, the kind of weakness and the loss of appetite, and how the body is growing thin, and all those things I have seen happening to them. But he said that they didn't went for, they were taking the homeopathic medicine, and he said that the most the satisfactory thing for me was that my father didn't suffer. He was talking with us till the final day, and when his time came, he said, okay, I just want to say goodbye to everyone because now my time has come. He said that I have seen many of my relatives who have been in ventilator from 1 year, sorry, 1 month, 15 days. No one can go in, no one. So he was with us. He died in front of us, and we were satisfied that he didn't had any pain. He didn't even did, like in his word, he didn't even did this thing. So like, uh, you know, we can help with homeopathy in such cases also. See, like Dr. Hahnemann has told us, even Dr. Kent in his 12 observation, he has described about the incurable cases. Although when we approach any patient, like even such a case, when we approach, the approach is that this is a curable case. The approach, the mindset is like that. Whether it will get cured or not cured, it depends upon lot of other things, and we will leave it to that thing. We will not try to go with that thing. Yes, our approach is that we want to cure this patient, but still, if the case is some kind of an incurable case, we can still help, with decreasing that rate, the speed at which the death will go on, and giving them relief in many other symptoms. So what we have to understand from this aphorism, footnote to aphorism 205 is, and he specifically saying, he had taken the example of cancer because it is seen in such cases, because the disease has become very violent at that time. There's a violence to the disease, and we know that it is a worst thing which has happened at that time. So what should we do? So this has been the case time without number, but the old school still goes blindly on in the same way in every new case with the same disastrous results. So we have to understand that removal of local symptoms, the symptoms which are on the local part, either it is some small eruption or a boil or some wart or some ulcer or some kind of cancer, it will always result in something which will be more dangerous than what it is. So as a physician, as a homeopathic physician, physician in general, homeopathic physician in particular, we have to keep in mind that these local infections which are coming, we have to educate the patients about it. We have to understand this thing, and then educate the patient also about this thing, that whatever will happen after the removal of this, if it is removed externally, by external means, by some kind of operations, by some kind of medicines, it will result in more bad thing. The reason is this, which is given in these aphorisms, and what we see in our clinics, in our cases, in our patient, we all have seen this thing. Whoever have seen such cases carefully would have noticed this thing without any doubt that this has happened. So with that, we will stop today's class here. There is something in the chat. Yep. Okay. Yeah, he applied some local, that patient in Thailand, he applied some local balm for knee pain, which I was telling you that he was. So Dr. Jonkol, she shared this message. So we have to understand this thing. So I will urge you again. I although already requested on the group to go through the last videos. Again, I will urge that go through these videos on the local symptoms so that it can get inside us. This thing can get inside us in our approach, that how we have to approach this thing. Many patients, they have local diseases from long time, and they want an immediate relief. We can relieve them, we can get them better, but there we have to make them understand also that sometimes it might take time. So we have to approach these cases in the same manner, that we have to understand that we have to remove the internal miasm. We have to look for the characteristics of the whole case. If the symptoms are there, look for them, some characteristics in those local symptoms. If they are unchanged from a long time of treatment, okay, and with this approach we can give the patients a chance to get cured completely, because the local application is never going to cure the patient. It is more it will, the disease is more going to go more deeper and deeper with that kind of treatment. And we should not, at least after this info, we should not do it. We should not do it. We should not tell anyone to do it. That if, okay, if you are not getting relief, then go use some ointment. No, that is a very like Dr. Hahnemann has told, that it is the most common criminal thing which the medical world has done. So we should not add into that. So with that, I will take your leave. Thank you. Thank you very much, and a good night. So today we are going to continue with a further aphorisms. We have done till 205. So today we will start with 206. So I hope that till this part, like we have done 205, 205 aphorisms of the organon. So I hope that the things are clear till now, because every time I tell uh, everyone that just go through the old aphorisms once we start with the new, that whatever we have done like in the last week, it is better that we go through that, we revise that thing again, and then continue with the next part, so that a link can be made. Because these aphorisms, they are like stairs. We are going up, we are ascending up. So the connection with each of them is very important. So in our mind also, that connection should be there, that this aphorism basically says this, and the next aphorism is about this thing. So I hope that because last time we started with the miasm thing, there was a little introduction of the miasms, that although in organon Dr. Hahnemann has not given a detailed view on the miasm part, but in his book of the chronic diseases, he has given a detailed view of the miasm, that what it is, how it is seen, what are the symptoms, what we have to bear in our mind when we are, although that part will come in this part also, in the organ part, that when we are taking the case, how we have to keep that miasmatic part in the mind, what we have to ask, what we have to see. So now these aphorisms, they are regarding the miasm, what should be done in which miasm when you see that thing in the patient in front of you. Then next we will start with the mental diseases. There will be a general introduction on what is disposition, why it is important, and then we will start with what are the mental diseases and how they should be cured basically. So aphorism 206, before commencing the treatment of a chronic disease. So before we start with any kind of treatment of a chronic disease, any kind of chronic disease which the patient is suffering from, when we start the treatment, it is necessary to make the most careful investigation as to whether the patient has had a venereal infection or an infection with the condylomatous gonorrhea. So he's saying that before commencing or before starting the treatment of any kind of disease, any kind of chronic disease, it is very important that we should ask the patient whether he had suffered from any kind of syphilis or gonorrhea. Whether he has taken any kind of treatment, whether he is currently suffering from it, because it is very important to know. For then the treatment must be directed towards this alone. And if he has suffered from that thing or he is currently suffering from that thing, then this part should be first treated with the anti-syphilitic or antipsychotic medications. For then the treatment must be directed towards this alone. So first we have to treat this part alone, because this is a secondary miasm. Because in such cases, like I'll tell you an example of such a case. We had this lady who was suffering from this destruction of the whole eyeball, the right eye. It was completely, when she came to us, she had this eye operated out, because this eyeball, it completely got necrosed without any reason, without anything. It started becoming inflamed. Then there was this pus discharge which started oozing out, and when she was checked, that the doctor told that it is completely destroyed and necrosed, and we have to take it out, otherwise the whole necrosis will go into the skull or the brain. So this right eyeball, it was completely removed, and when she came to us, the left eyeball started getting involved with the same kind of affection. So then she came to us. So when we took the case, we were seeing, and when you have been seeing the cases from so long, something strikes you that how come so suddenly this, so much destructive process has happened with this person without any prior disease. There was nothing prior to it, and suddenly she started getting this thing. So when there's difficulty in making that connection, that you are not able to understand that from where it has come suddenly. And that is the time, although we should do it in each and every case, but the I will just tell you, where we usually ask about these things, but the patients, they sometimes conceal it, they don't give the information about it. So even in those cases, we should have this thing in the mind by looking at the disease, by looking at certain symptoms, that he might have suffered from that syphilis or gonorrhea, he or she. So we asked her that whether you have taken any kind of such treatment or you have suffered from this kind of problem. So she said, no, no, I have never. So, and then we asked about the husband, that whether the husband has, like, according to your knowledge, has your husband suffered from this kind of problem, or he has? And she said, no, no, not that I have heard of, or if you want, I'll ask him, but I don't think he has. And he told that he has not, when she asked him next time. But still in the mind, it was no, that somewhere, this picture is of the secondary symptoms of syphilis. That's, it does not fit into that, how the psoric miasm progresses, it does not fit into that. So we gave the medicine. I wrote it down in a query that maybe we will need some antisyphilitic treatment along with it. So by the chance, how how the journey of some patient has to go, next time the husband also came for taking the medications. He wanted to go abroad and he wanted to submit for his medical records. He had some issues with his liver and SGOT, SGPT. So we gave the medicine, and next, after 15 days, he had to conduct these tests which are necessary for going abroad to settle. So in those tests, he came out to be, the syphilis came out to be positive. So then I asked him about, then yes, I had some kind of this thing in the past, some kind of relation, and I got infected and I was treated for it. So that became confirmed, but still before that we had already started with that lady, this anti-syphilitic, like we started with the Merck Soul for her. We will go into those details later on in some other time. But it is very important to know in such chronic cases that whether there has been these kind of affections or this to the patient, so that we can basically take care of that also. Because the first thing is that before starting any antisoric treatment, we have to start with the antisyphilitic or antipsychotic treatments if they are present. So when they are present, the treatment must be directed towards this alone when only the signs of syphilis or of a rare condylomatous disease are present. But this disease is very seldom met with alone nowadays. So nowadays, we don't get such, even with the patients coming to us, very rarely you will get an acute or recent case of syphilis or gonorrhea, because most of them have been maltreated. Some medicines have been taken. The patients, they don't disclose it very easily, but still we have to do our duty according to what is told to us. If such infection has previously occurred, this must also be borne in mind in the treatment of those cases in which sora is present. So because when the sora and psychosis and syphilis, they mix up, they become a very complicated picture, because in them the latter is complicated with the former, as is always the case when the symptoms are not those of pure syphilis. So when the symptoms are not of pure syphilis, then the sora, most of the time the soric affection is already going on in between the syphilis or the psychosis. The gonorrhea, it peaks up and they become intermingled. For when the physician thinks he has a case of old venereal disease before him, he has always or almost always to treat a syphilitic affection accompanied mostly by complicated with sora. For the internal itch dyscrasia, the sora is far the most frequent, most certain fundamental cause of chronic diseases, either united, complicated with syphilis or with psychosis, if the later infections have avidly occurred. So in such cases where patient has been affected or infected by the venereal diseases, because without the permission of sora, even the psychosis and syphilis, they cannot come in. Mostly psychosis and syphilis, they come when the sora is in a latent stage. So, but when we have to cure it, when we have to treat it, when we have to give up medicine to the patient and they are suffering from this kind of the thing, so we have to remove that kind of symptoms. We have to remove those symptoms of the venereal miasms first, and then give an anti-soric or a constitutional remedy to the patient. This does not happen in every case. Okay, there are cases which are of pure soric origin. Most of the cases are of pure. Only in certain cases you require this kind of treatment or this kind of thing which is given in the book Chronic Miasm. There are many kind of variable treatments given when a patient is suffering from psychosis or syphilis, depending upon whether it is of recent occurrence or of some old occurrence or it has been suppressed. So depending upon the medicines are given for removal of it, but it is very I will not say rarely, but very less frequently encountered thing. Or as is much more frequently the case, sora is the sole fundamental cause of all other chronic maladies. Okay? So basically, sora is the sole fundamental cause of all the chronic maladies, whatever names they may bear, which are moreover so often bungled, increased and disfigured to a monstrous extent by allopathic unskillfulness. So all the chronic maladies which come naturally, sora is the fundamental cause for that. And when they're bungled up with some kind of medications, because in chronic disease what happens is that when some, for example, someone is having some kind of neuralgic pains from a long time, some kind of GIT trouble, some dyspepsia, and they have been taking some medications, some allopathic medications or some other medications which have been aimed at the uh, disease, not on the whole, not on the sick patient. So some symptoms they get bungled up. Bungled up means that the original picture is lost. Some symptoms of the medicinal disease they start coming up, they start forming up, which we call as the side effects. Okay, but that is a medicinal disease, because once you start telling people that it is a medicinal disease, the people will become afraid of medicine. So we call them as the side effects, that medicine is affecting in a positive way, but some side effects are there. But no, it is not side effect, it is basically the medicinal disease, it is a medicinal dyscrasia. So footnote to aphorism 206. In investigations of this nature, we must not allow ourselves to be deceived by the assertions of the patients or their friends, who frequently assign as the cause of chronic, even of the severest and most inveterate diseases, either a cold caught, a thorough wetting, drinking cold water after being heated many years ago. So in this aphorism, basically Dr. Hahnemann wants the physician, wants the homeopathic doctor to know this thing, that the chronic disease, when you are dealing with the chronic diseases, there is something which has caused that disease and which is basically keeping it up, keeping the symptoms up. For example, if you get affected by cold air, okay, you will sneeze, some mucus will come, but after a few minutes or an hour it will settle down, or a day it will settle down on its own, because now you are not being getting continuously exposed to the cold air. So there is no need for the body to react to it, because there is no stimulus. But in chronic diseases, when we see at the chronic, for example, diabetes is there, for example, hypertension is there are some chronic pains, there are some chronic weaknesses which are happening, some chronic headaches. So what are the things which are making, basically stimulating that thing all the time and keeping it up in the patient? So there has to be some constant cause, some fundamental cause to it, which is making those symptoms and keeping it up. They are developed and they remain there, or they develop into something next. So because of this thing, Dr. Hahnemann wants it to be very clear for the physician that some old cold or some cold which patient once caught by getting wet or by drinking some cold water or by being heated, it cannot be the cause of a chronic disease which has happened years ago. Many times patients will come that, okay, once 5 years ago, 6 years ago, he had a this, he went to the mountains, he got exposed to the cold, and he started having this breathing difficulty, and from that time he has developed this asthma or some chronic bronchitis. That cannot happen. At once some cold, and it even after 5 years, 6 years, that is still acting upon the person. No, it cannot. Those things can basically stimulate the patient from the latent sora stage, but they cannot keep acting, or they are not the producers of the disease. Or a former fright, a sprain, a vexation, sometimes even a bewitchment, etc. Or some kind of vexation many years ago, or some sprain and some fright, or some kind of, if patient think that some black magic was done on him, those things, they cannot keep up a chronic disease. These causes are much too insignificant to develop a chronic disease in a healthy body, to keep it up for years and to aggravate year by year, and every year the problem is aggravating. Like we have also talked about it many times before also, that once a chronic disease starts, it keeps on increasing. It keeps on increasing until a right remedy is not given. It will keep on increasing. So year by year it is increasing, it is getting aggravated, it is there all the time. So those small things, those small affections which once happened, they cannot keep it up and keep it increasing every year. There has to be something more deeper than that, as is the case with all chronic diseases from developed sura. So Dr. Hahnemann, he gave this miasm the name of Sura. This is the miasm from where everything is developing. Causes of a much more important character than these remembered noxious influences must lie at the root of the initiation and progress of a serious obstinate disease of long standing, because they are very obstinate diseases. Chronic diseases are very obstinate. The progress is a serious progress. They are progressing continuously from long time. So these assigned causes, or these causes which the patient is telling about or the attendants are telling about, they don't make a sense for that thing. So the assigned causes could not only rouse into activity the latent chronic miasm. Like I told you, that if they can only just bring out the latent chronic miasm, but it was always there. It was ready to erupt. One small stimulus and it will erupt out. But that is not the cause. So we have to understand this thing. So when the above information has been gained, it still remains for the homeopathic physician to ascertain what kinds of allopathic treatment had up to that date been adopted for the chronic diseases, what perturbing medicines had been chiefly and most frequently employed, also what mineral baths had been used and what effects these had produced, in order to understand in some measure the degeneration of the disease from its original state. So once we have taken this information, now we are gathering the information, from where all these symptoms are coming in a chronic disease, whether they are from the psychotic miasm or the syphilitic miasm, or they purely belong to the psoric miasm, or they basically belong to the medicinal disease, which have been caused by the various treatments, various kind of the things which have been applied or employed by the patient. Okay? So we have to understand whether what kind of effects these medicines, the allopathic treatment, from how long the patient has been taking, what new symptoms came up after this medication. Patients usually know about this, that these symptoms basically started when I started taking that medication. So they usually know until the symptoms are very subtle, or they have not been come to the conscious part of the patient. Usually the patients, they know that these things happened after I started taking this or that medicine. So in order to understand in some measure the degeneration of the disease from its original state, and we also have to understand that how much the disease is more degenerated or more complicated from its original state. Okay, and where possible, to correct in part these pernicious artificial operations, and how we can make some changes to his medication, or how he takes or what he takes, whether, like, many a times, this pentoparazole, it is always given, some antacid is always given with the medications, or some kind of uh, whenever a patient has blood pressure, some kind of statins, they are always prescribed. So we have to understand whether these medications, if even the patient has been taking from a long time, which of the medicines we should tell them not to use right now, or to enable him to avoid the employment of medicines. Okay, which medicines can be, removed from the is this medicinal diet. We call it medicinal diet because, you know, we, some people, they take medicines as if they are taking food. I was, like, recently a patient came. She was taking 18 different kind of medicines in a day. 18 medicines. So whatever was necessary, at that particular, because many times the patients, when they are taking medications from very, very, very long time, the body has become dependent upon them. So suddenly we cannot tell them to stop. If it is of recent, this thing, not very serious condition, usually we tell them, okay, you can stop this. We are giving the medicine and it will take care of it. But then when the patients, they are completely dependent upon that thing. Many patients who have interstitial lung disease, like recently I had a patient, that lady is completely dependent upon steroids. Even if one dose is missed, and the whole this body will start getting swollen and she will start having difficulty in breathing. So in those cases, we cannot say them to stop the medication immediately. But at least we can remove those medications which are not required from her this part of the medicinal routine, so that the body can have less to fight against. Because at the end, the body has to fight against the disease. We are just helping the body, we are just helping the vital force with our medicines, but at the end the vital force has to fight against that part. So the more pressure is put on the vital force by these kind of medicinal diseases, those kind of things which are not needed. So with our interception, we can basically do this thing is that decrease some medicines which are not required. So just we have to keep a note, make a note of what kind of medicine they have taken or have been taking, so that we can tell them how to decrease the dose, or how they have to manage this thing. So the age of the patient, his mode of living and diet, his occupation, his domestic position, his social relation, and so forth must next be taken into consideration. So next we have to take into consideration is the age of the patient, what kind of age is of the patient is, whether that is somehow hindering or favoring the disease process, his mode of living, how he lives, what kind of diet he's having, what kind of occupation he's having. For example, if a patient is basically working in a factory or working in a place where there is too much of dust, and he has to put on the mask all the time, so we have to consider that thing, that may be also a part or a small part of the causation which can be removed. We can tell them that with your conditions of this thing, don't do work there. His domestic position, how it is, how are his social relations, must next be taken into consideration in order to ascertain whether these things have tended to increase his malady. That something out of this, for example, if someone is in a relationship which is harming him, some kind of friend, some kind of boyfriend, girlfriend, some kind of relative, or some partner in the business where he has been taking a lot of hit, so we have to advise them accordingly. It is our duty as a physician to advise them that this thing is affecting you, make some amendments about it, get out of it, or do something else, or in how far they may favor or hinder the treatment, and how those things may favor or hinder the treatment, that also we have to assess, that what he should do which can help the treatment, or what he should stop out of all this thing, some part of his occupation, some part of his diet, some part of how he has been living. Like the person is having a very sluggish routine, so we must advise him that go for some walk, you can go do some exercise, stretch yourself, so that it can favor that treatment. In like manner, the state of his disposition and mind must be attended to. So similarly, we have to also see what kind of state of mind he has been, whether he's anxious, whether he's sad, and what is making him anxious or sad or angry or depressed, how is he, or requires to be directed, encouraged, or modified. And we have to see also, assess also, whether his this mental state or disposition, rather we need to direct it or encourage it, whatever he is doing, or it should be directed to something else, or somehow if we can modify it. The pathological states of the mind, although it will come in the next aphorisms, that there are different kind of stages, and where we can intercept or interject it, or where we should not, everything will come in the coming aphorisms till aphorism 230, and we'll go through one by one. But there are some states of the mind or of the which have come as pathology, so there you cannot direct it. We have to understand this thing. For example, a patient who is suffering from autism, you cannot direct him or modify his behavior. He's not going to listen to you. On the contrary, we may aggravate the situation. The child, he or she will not, they will not listen to the advice because they're in a some pathological state, some disease state. But then there are something which is happening because of the circumstances around us. You know, like for example, today a couple came to our clinic. Me and Dr. Vidya, we were there, my wife, and this couple, they were telling about the symptoms or the things which they are going through, and their, the personal thing about what was in their relation, that. So we gave them some advices. We gave them how they can, and when they were about to go, they were happy that okay, maybe this can help us, in getting better as a person, also as a couple, also. So when the circumstances are like that, then yes, your encouragement or this direction of the mind or the disposition, it will help. You encourage someone, you tell them that they can do this thing this way, it goes to the mind, they can take it and they can do as you have advised them to do. But not in a state of pathology. When we will be talking about the mental disease next, and I think maybe next week we will be talking about them. So there you will see that there no encouragement, no advice, nothing can help the patient. On the contrary, it will aggravate. So as a physician, that is also what we have to decide, that in which category this patient is. Whether the patient is basically suffering from a pure complete mental disease, a pathological mental disease, or just some emotional disease because of the circumstances, because of the part of the life which has been there. So after this is done, the physician should endeavor in repeated conversations with the patient to trace the picture of his disease as completely as possible according to the directions given above, in order to be able to elucidate the most striking and peculiar characteristic symptoms. So the physician, he should go into repeated conversations with the patient, take a complete picture, depending upon the miasms, depending upon some kind of medicinal disease, all the steps which have been told us during the case taking. So we have to ask again and again about these things, make it more confirmed, make it more particular, so that we can find some characteristic symptoms. Like now, you all have been going through all these aphorisms in these lectures. You can see how many times Dr. Hahnemann has used this word characteristic symptom, because it is very important and it will keep coming on again and again, because all this thing which we are doing, going through whole the case, asking about the history, asking about some kind of diseases which the patient had, asking about what kind of medicines he have taken, this all is to find the characteristic symptoms. That is the goal, that is the aim, that is the motive, in accordance with which he selects the first antipsoric or other remedy. Because only this finding of the characteristic symptoms, it can help us in selecting which medicine we have to give, so that our medicine is symptomatically or homeopathic to the disease. Other remedy having the greatest symptomatic resemblance for the commencement of the treatment, and so forth. So aphorism 210, we will start from here, because from here the mental disease will start. The aphorisms on the mental diseases, how we have to understand them. From here they will start. So we will start it in next class. We will stop at 209 today. And again, just go through these aphorisms. I will also, although I have taken a lecture, if I don't know if it is present on YouTube, maybe if it is present, Dr. Rishabh, he will share that particular lecture with you in the group. But if it is not present on the YouTube, or if it is not present with us, then go through the chapter in Dr. Kent's philosophy. There are two chapters on Sora. I will also say that go with the psychosis and syphilis, but at least go with the Sora. What Dr. Kent there describes about Sora is a wonderful explanation. Dr. Henneman has given a wonderful explanation on the Sora, but that explanation has confused physicians because the physicians did not join it, the understanding of that Sora, they didn't join it with the organon. If you join both the things, if you keep both the things and try to understand, then you will have a very good understanding what Dr. Henneman wants to tell you. And that understanding is told by Dr. Kent when he tells about Sura, because he has joined both the things, the organon and the chronic disease. When you see, look at both the things at a one single go, then you get a beautiful picture of what Dr. Henneman wants to tell us about Sura. But still, if before that, I will again tell you that go through that chapter of Sura. There are two chapters of Sura in Dr. Kent's philosophy. Okay, there is a question. I'll address to it later. So there are two chapters on Dr. Kent in Dr. Kent's philosophy on Sura. Go through them. Try to understand each and every word what Dr. Kent wants to tell, and you will have a very beautiful understanding of Sura, what it is. If we can get that lecture, if it is present on YouTube, we will put it there. But still, if you listen to the lecture, if we find the lecture and you listen to it, still go through those two chapters in Dr. Kent's philosophy. So Vishwangi asks, can long-term grief, disappointment, vexation cause chronic disease? There is nothing like a long-term grief or disappointment. Just look at your life. There are phases in the life when you are sad and you are happy. So we will not say that, for example, something happened at one particular time. With the passage of time, the emotion or the memory of that thing will decrease. It will never increase, first of all. For example, there was some sudden death in the family. With the passage of the time, yes, you will remember that person. You may cry sometimes, but the memory and the wound or the hurt, it decreases. That is the nature. That is the basic nature of everything which is universe. Okay, that nothing is steady. Even the pain is not steady. Even the grief is not steady. Even the disappointments are not steady. We move on. That is how we have been evolved. That is how we have been as an organism of this whole universe. So there is nothing like a long-term grief. Yes, things can add on to that grief, to that disappointment, to those vexations. Some new things can come up which can make it more bigger. But again, it will not be a long-term thing. There are phases when you are happy. There are phases when you are sad. There are phases when you are successful. There are phases when you are disappointed. There are phases when you are angry. There are phases when you are happy. So that is all ups and downs of the life. But if we see that grief or an event in the life can cause a long-term effect on us, then no, it cannot. One event cannot. Many events they can, but then there will be different kind of effects which will again be temporary, or this part becomes a state of disposition which we'll talk about in next this thing. If the sadness becomes a state of disposition, then yes, that sadness that can cause or become a part of the chronic disease, not cause the chronic disease, but it becomes a part of that chronic disease. Causation is somewhere else. Causation is not here. All these things, they happen because a patient is suffering from Sora. The state of mind, if it is into some kind of grief, disappointment, vexation, some lack of confidence, a patient has gone into that state, continuous state. That is because of the Sora which has already been happening. That is why I am saying you just go and read that chapter on Sora, or listen to the lecture if we find it. Then if you still have any question about it, any doubt about it, we can again talk. But first go through that. But yes, to the question that no, it cannot, because there are no long-term griefs or disappointments or vexations. State of minds are there, which we call as dispositions, But then again, that is a part of the disease, not the causation of the disease. What is disease cannot be the cause. So cause is again Sura, and we have to understand what is Sura, how it basically develops in us, and how it starts affecting the physical body. So with that, I will take your leave. Just go through these aphorisms once again, and from next Wednesday we will start with the mental diseases, because next Wednesday we will have this lecture, but then next like week next to the next week we cannot be having, because I will be traveling at that time. So I think that next week we will try to do around 9 to 10 aphorisms, so that one part of mental disease we can clear out, that what is the mental disease and how we have to proceed it, how we have to see it. So with that, I will take your leave. Thank you. A very good evening to all of you. So after a long gap, we are restarting the organ classes. So we have done till aphorism 209. So we'll start with aphorism 210. From this point, the discussion on the mental diseases will start. There is differentiations among the different kind of mental diseases. There are some emotional diseases, there are some mental diseases. So as we go along in the aphorisms, we will try to discuss those differentiations and how we have to go along in those cases, how we have to understand those cases, how we have to tweak some of our points in the case taking, so that we can come up with a remedy for such patients so that they can get cured. So we will start with our presentation. So aphorism 210. So we are talking about the one-sided diseases, that diseases which come only on one single part of the body. They show very few symptoms, but when examined carefully, those few symptoms can give us the complete picture of the disease itself. So of psoric origin are almost all those diseases that I have above termed one-sided. And all these one-sided diseases, whether they are coming on the local parts, whether they are coming on the part of the mind, they're all of psoric origin, which appear to be more difficult to cure in consequence of this one-sidedness, all their other morbid symptoms disappearing as it were before the single great prominent symptom. So again, just to recap, that once in one-sided diseases, we have very few symptoms or no symptoms at all, only just one single prominent symptom or one or two prominent symptoms which are there in front of us, while all the symptoms have disappeared. So Dr. Hahnemann is saying that it is difficult to cure them because they do not have much symptoms. They do not have symptoms which can stand out as very characteristic symptoms. So we have only very few symptoms. We have only some symptoms, but those are prominent ones. We have talked in the last few aphorisms that those symptoms are very prominent ones. And when a remedy is prescribed on those symptoms, it can cure the whole case. So of this character are what are termed mental diseases. Even the mental diseases, they have the same kind of character, that they have one-sidedness to them. They do not, however, constitute a class of disease sharply separated from all others, since in all other so-called corporeal diseases, the condition of the disposition and mind is always altered. There is no disease which we can call is a completely physical disease. If some part of the disease body is getting diseased, the whole is always involved. Even if we are having pain in some part of the disease, the mind, the rest of the body, they are all involved, they're all feeling that pain. So Dr. Hahnemann here is saying that although I am calling this part or these kind of symptoms as mental diseases, but they do not constitute a separate class. Because why he's saying that? Because in all the corporeal, all the physical diseases, the mind and the disposition is always altered. There is no disease. Even Dr. Boeing Hassan states that during the stages of latent sora, the sora is basically how the disease shows itself on the physical body with any kind of symptoms. When it comes on the body, we say that, okay, this is a psoriatic disease or a psychotic disease or a syphilitic disease. So that is when it is shown on the physical body. But in the state of latency, when it is not showing itself on the physical body, the disease is not gone. It is trying to develop at the parts of the mind in different kinds of emotions and different kinds of behaviors. So it is not until and unless some very good treatment is given to a patient, we cannot say that we are healthy or we are basically disease free or any other patient is disease free. Just the absence of symptoms at a particular time, it should not be considered that the patient is healthy. We have to see where it has gone. Where are all the symptoms gone? Dr. Boeing-Hausen in his lesser writings, there is a one of the chapters where he mentions this thing that during that stage of latency, a physician should always see that what are the changes coming in the behavior or the mental part of the patient, because it is developing there at that time. So there is no physical disease which comes without the alteration of disposition and mind. So because of that, he's saying that this is not a different class of disease, but yes, we can call it mental disease. Why? Because here the disease is more prominent on the mind. And in all cases of disease, we are called on to cure. The state of patient's disposition is to be particularly noted. And in every case, all the cases where we are uh, called to cure a patient, we always say that disposition is a very characteristic part of the patient. For example, there was a child today who came, a cerebral palsy child. So when I was looking at his symptoms, some symptoms of convulsion, some symptoms, his physical symptoms, Naxwamika was coming very prominently. The kind of the constipation, the kind of the sensitivities that child had. So Naxwamika was coming very prominently. But he was a very, very smiling child. The parents told that he never gets irritated. He's always smiling, he's always laughing, very easy to be pleased. So that goes completely against the disposition of Naxwamika. And that should only be one symptom which should stop us from prescribing this remedy. Because the state of the disposition is a very, very prominent characteristic part of the patient and it should not be ignored. It can never be ignored. So the state of the patient disposition is to be particularly noted along with the totality of the symptoms. So whenever we are called upon to see a patient, when we are taking a case, when we are assessing the medicine, when we are analyzing the medicine of the patient, the disposition of the patient should particularly be noted and it should be among the totality of symptoms which the medicine should cover. If we would trace an accurate picture of the disease, and we have talked about this thing when we have talked about sora, we have talked about this part of the disposition, that how it develops and why it is given so much importance. Why, like I told you just right now, the example that even having very strong symptoms of some remedy, we can basically rule out that remedy, or we can just get it out from our analysis because it does not matches the disposition of the patient, or the patient does not have the disposition of the remedy which we were going to prescribe. So it holds so much importance. So if we would trace an accurate picture of the disease in order to be able therefrom to treat it homeopathically with success. So if we wish to cure the patient, if we want to treat the patient successfully, and in order to trace a right picture of the disease, the disposition has to be included in that accurate picture. Only the picture of the disease will become accurate if we have added the disposition of the patient to that part. So this only thing, this only line, this only these words can tell us that how important it is to understand the disposition of the patient and how important it is to include in our analysis. So there's a footnote to aphorism 210. How often, for instance, do we not meet with a mild soft disposition in patients who have for years been afflicted with the most painful diseases, so that the physician feels constrained to esteem and compassionate the sufferer? So Dr. Hahnemann is giving some example of the patients like who have been very mild and soft, and from a long time they have been affected by some kind of painful disease. And when you see the condition of the patient, we feel sympathetic towards them. We feel that how much they are suffering, and we feel uh, constrained to help those patients. But if he subdue the disease and restore the patient to health, as is frequently done in homeopathic practice, he is often astonished and horrified at the frightful alteration in his disposition. And sometimes, when the patient gets better, when the physician is able to restore the patient, which is frequently done with the homeopathy, he says that sometimes you are very astonished. And this has once happened to me. The same thing which Dr. Hahnemann is writing about with one of the patients who was suffering from a kind of like he was dying. He was in that state of uh, disease, and he came out of it. He went on to become healthy, and you see that how that disposition, because the mind has been changed during that process of disease. Some parts of the mind which the formerly the patient was, that has changed. So you can see that change in the disposition when the physical health is also getting better. He often witnessed the occurrence of ingratitude, cruelty, refined malice, and propensities most disgraceful and disregarding to humanity, which were precisely the qualities possessed by the patient before he grew ill. So before he went into that kind of state, when he went, even many times in acute diseases, you can see these kind of things in acute diseases. Suddenly a patient who has been very mild in a fever, very want like a pulsatilla person, once he gets better, he comes to his this older self of being dominating, of being angry, of being abrupt, the who was very soft and sweet during that acute phase. So main thing to understand is that whenever some disease processes start, they basically affect the disposition of the patient. Those who were patient when off well often become obstinate and violent, hasty or even intolerant, and capricious or impatient or desponding when ill. Those formerly chaste and modest often become lascivious and shameless. A clear headed person not infrequently becomes obtuse of intellect, while one ordinarily weak minded becomes more prudent and thoughtful. So, in the mental picture, also, the intelligence gets affected, the disposition, the emotions get affected, the behavior gets affected, the will gets affected whenever the disease process is going on. And a man slow to make up his mind sometimes acquires great presence of mind and quickness of resolve. So both the things uh, can happen in the state of mind. Anything can get affected in the state of mind when the disease is going on. So that is this is an example which Dr. Henneman is giving to make us understand that how much it is important to consider the state of the mind and the disposition of the patient when we are prescribing. because they are already and every time affected, even in the physical disease. Even when the physically a patient is becoming weak, or he's getting diseased, or he's having some kind of pain, he's having some kind of chronic disease, the mind and disposition, they are always affected, and they should always be taken in the selection of the remedy. So this holds good to such an extent that the state of the disposition of the patient often chiefly determines the selection of homeopathic remedy. And it is so good to that an extent that it becomes a prominent symptom, the disposition of the state of mind. It becomes a prominent symptom in determine in selection of the homeopathic remedy. Like I gave you the example of Naxwamika. That disposition of the boy, it became a, like, he's so openly affectionate. So you need to think about the remedies which are openly affectionate like that. Or at least we will not give the remedy which is completely opposite. That is how the rule out system works, how we have to throw out a remedy from our analysis. As being a decidedly characteristic symptom, which can least of all remain concealed from the accurately observing physician. And the thing about disposition, the thing about the behavior is that the patient can never withhold that from us. He can never withhold. If a patient is fearful, that fear will be shown. The way he talks, the way he is behaving. If a patient is timid, that will be shown. They will be soft in speaking, they will be low in speaking, the voice will be low, the eye contact will not be there. Okay. So if a patient is impatient, if a patient is, who can suddenly go, that will also be seen. Even if he is trying to control himself, or she is trying to control herself, that irritation will come up in some kind of words. So if we are observing in a very, very accurate way, that symptom can never remain concealed. That symptom can never remain in obtuse state. It will always be revealed. It will always be shown. The creator of therapeutic agents, very beautiful word, the creator of therapeutic agents has also had particular regard to this main feature of all diseases, the altered state of the disposition and mind. For there is no powerful medicinal substance in the world which does not very notably alter the state of the disposition and the mind in the healthy individual who tests it, and every medicine does so in a different manner. So he's saying that the creator, when he was making these therapeutic agents, he kept this thing in his mind. He kept this thing in a very particular regard, that all the features of the disease, that there is no therapeutic agent, anything which can cure a disease, or when given to a healthy patient can alter or bring out the symptoms of a disease. He's saying that no, there is no such agent which does not alter the state of disposition of mind. So the creator of these therapeutic agents, he kept this thing in main regard, that whenever the disease is going to come, it is also going to affect mind and disposition. So the therapeutic agent, so the medicine, it should have the power to cure that mind and disposition also, along with the physical part. So he's saying that if whenever you will test some therapeutic agent, you will always see that the mind and the disposition, they are always irritated. A very good example is quinine. Quinine is a medicine which have been used a lot, and I think that almost all the doctors, the old doctors, or doctors who have given allopathic medicine, or they have recorded in a very detailed manner what has happened to the patients after the quinine. It was a very common thing which came with the quinine, that whenever it was given in large quantities to the patient, there was an intense irritability of mind, which comes with the quinine. Or a very uh, low state of mind, a dull state of mind, which is produced by the mercury. So even the doctors who did not took or gave medicine with keeping this thing in mind, that I have to prove the medicine or I have to see the effects of medicine, they were just giving the medicine as it was supposed to be given. But they also noted these kind of changes in the mental or the dispositional part of the patients, that after this medicine the patient has become more aggressive, more irritable, or he has lost the chain of thought, the intellect has become low after the medication. Because all the medicinal agents, they have this power to affect the mind and disposition when given in the healthy state, or even in the other states when given in large doses, they have this power to affect the mind and the body. So we shall therefore never be able to cure conformably to nature, that is to say homeopathically, if we do not, in every case of disease, even in such as are acute, observe along with the other symptoms those relating to the changes in the state of the mind and disposition. So he's saying that we cannot cure homeopathically any patient, and it is very true. It is very true. I have seen doctors who have been prescribing from years just on the physical symptoms, just on some keynote symptoms, although they are taking it as a characteristic symptom, although they see that it is a something which is unique in the patient, but on a physical part, like for example, if I would have given Nux vomica today, what would have happened? It would have ameliorated some symptoms. It would have ameliorated some symptoms which Nux vomica would be similar to, or given a partial relief. They might have come afterwards, but the patient will not be cured. And I have seen this thing happening, that when we have given some uh, patient some medicine without considering or without taking into our analysis the mind, and the patients, they don't get better or they do not cure homeopathically as we believe that they should get cured. The second aphorism, the ideal cure, how it should happen, they don't get cured like that. They don't get better like that. The symptoms they will come back, or some new symptoms will take place of the old symptom which is gone if it was of less intensity, but the patient remains sick. So even in acute cases, not only chronic cases, but even in acute cases, it is very important to take the change in the state of mind and disposition, how the mind and the disposition of a patient is changing over the course of time. And if we do not select for the patient's relief from among the medicines the disease force, which in addition to the similarity of its other symptoms to those of the disease is also capable of producing a similar state of the disposition and similar state of disposition and mind. I think just let me check if this it is written in a complete form. 213. Ah, yes, okay. So we will never be able to confirmably cure. We will not be, if we are not selecting a remedy which can basically affect the similar state and the disposition of the mind as it is shown in the patient. We have to select the same remedy, a similar remedy to that state of the mind and disposition. And every word is true, because this thing has happened to me and I have seen it happening to many of other doctors around me when we have talked, some old doctors also, when I have seen their cases, that whenever this thing was not taken into conformity, into that final analysis, the cure did not came. The cure never came. There was a partial relief. There was some symptoms which have gone, but the patient always remained same. Because when I started understanding it in a more deeper manner, when I went more deep into that thing, the sora is coming from somewhere of that state. The sora is basically arising from such states. So it is a very direct, we can say. I'm not saying that sora is a mental picture. No, please don't take it in that way. No. But somewhere when the sora is affecting, it is affecting that disposition part and the mind part also, along with the physical body. It is developing everywhere in the body. So when it is developing everywhere in the body, and many times you have seen in yourself, whenever we are overpowered by some kind of emotional state which we are already having. For example, we are more overpowered with despair. Something, the things are not working the way we want them to work. The things are not happening as they are supposed to be. No? So we start getting more anxious or sometimes more sad. We are feeling that there is more failure than the success. So the body starts feeling more weak. There will be some kind of disease or symptoms which will start appearing, which will make us more weak. Some kind of pains will start coming up. Some kind of muscular pains, or some kind of weakness of the muscles. Some kind of states would start coming up where the body will feel more lethargic. Feverish feeling will start coming up. So there is a very close relation with the physical symptoms or the physical disease and the mental disposition, how we are feeling at that time. Suddenly if something good happens, you are in a state of elation, you are very happy, something has worked for you. Even the chronic pains, they subside for some time. Some kind of pain which was there, I always give an example that if there is a very good function going, like for example you are celebrating something, you are celebrating a birthday, you are celebrating an anniversary, you are celebrating some marriage in the house, suddenly the whole family is active. Even those patients, those people who have been suffering chronically from some kind of pain or something, they also start working up, or doing something which in the normal days you cannot think of that person that they can do this thing. So suddenly when we are into that state of excitement, into that state, suddenly the whole body starts working in a very fine way. So there is always this psychosomatic relation there. It is always there. We cannot deny that the mind and the body, they get diseased separately. They are diseased at the same time. They get better at the same time. After the medicine, when the patients they start getting better, if it is a right remedy, if it is a homeopathic remedy, you will see that they start becoming better in every way. Not only their physical symptoms, but the mind shift is there. All those negative emotions, all those negative behavior, they start becoming less intensified, and good emotions or good behaviors. I have seen people who have stopped going for morning walks or exercises from 10 years, 12 years, because they didn't felt like it, because they had some pain in the they start going, they start doing it. They start feeling that kind of energy that yes, I want to do it. The people who were not able to uh, do some mental work because they felt dull, they felt there is no energy in the body, they start reading. They start reading the newspaper, they start enjoying the talks, they start enjoying the discussions. So when the disease is affecting, the whole is getting affected. And when the disease or the patient is getting cured, the whole should get cured. So footnote to aphorism 213. Thus, aconite will seldom or never affect either a rapid or permanent cure in a patient of quiet, calm, equable disposition. So if a patient is of calm disposition, quiet disposition, the aconite will never affect either a rapid or a permanent cure, because the aconite is a very sudden remedy, very uh, angry remedy, very you can say blasting remedy. So if a patient is of quiet nature, very equable nature, very calm, aconite does not is not similar to that disposition. And just as little will nux vomica be serviceable, where disposition is mild and phlegmatic. If a patient is mild, like I told you that today the patient was very mild, extrovert, laughing kind of child, very happy child. Nux vomica will not work in those states, even if it is matching these symptoms. Pulsatilla, where it is happy, gay, and obstinate, because pulsatilla is basically a sad remedy. Pulsatilla is a mild and yielding remedy. So if a patient is very obstinate, very happy patient, you know, he is a very dominating patient, the pulsatilla will not work there. Or ignitia, where it is imperturbable and disposed neither to be frightened nor vexed. And ignitia will not work there where the person does not get frightened easily or does not get angered easily. The ignitia do not work, because ignitia has a disposition, very sensitive, oversensitive disposition, which goes into strong emotional states very quickly. So if a patient is more of a very slow in his emotions, not showing much of his emotions, very controlled in the emotions, ignitia will not work as good there, as it is supposed to be. So the instructions I have to give relative to the cure of mental diseases may be confined to a very few remarks, as they are to be cured in the same way as all other diseases, namely by a remedy which shows by the symptoms it causes in the body and mind of a healthy individual a power of producing a morbid state as similar as possible to the case of disease before us, and in no other way can they be cured. So he's saying that when I'm going to give some remarks on the mental diseases, it will not be very different thing till what we have discussed till now, because they are to be cured in the same way as all the other diseases, because in all the other diseases the mind and the state of the disposition, they are always affected. So there is nothing very different which we have to do. Yes, there will be some points, there will be some things which we need to consider more, or we in the choice of the remedies we have to give importance to certain remedies which can produce these kind of states uniquely, because every medicine, it produces a unique state of mental picture, the dispositional picture. They have their unique states. So we have to understand those unique states from our materia medica also, and we have to understand those unique states in the patients also. Okay. So a power of producing a morbid state of the mental disease as similar as possible to the case of disease before us, and in no other way can they be cured. And there is no other way to cure them. There is no other way, because many times he will give the distinction of those diseases, that sometimes people think that the advice or counseling or some kind of you know if we can talk to some patient who have been suffering from mental disease, it can get them better. We should be very very cautious about that, because in certain mental diseases the counseling or any kind of remark which we are telling the patient, which we are telling them to follow, it can produce a very negative result. So we will be talking in the further aphorisms when we will go through them. So we have to understand that there is no other way. And I have seen patients who have been taking so many kind of medications, so many kind of therapies, so many kind of uh, things they had been doing their whole life in such conditions when they have been suffering from these kind of mental diseases. Some things have helped them for some time, but nothing has, you know no therapy or no other medication have been able to cure the patient. Because whenever we are talking in homeopathy, we are talking about cure. Cure means that the patient should go to the healthy state. He should be healthy. He should no longer be diseased. So in order to produce that cure, Dr. Hahnemann is saying out of his experience, because he had also um, done all kind of things during his time, and he was a better person to tell this thing. And even the doctors who have been practicing from past 30 years, 35 years, 40 years, they can easily see when they have seen thousands of patients of that kind, and they can ask about what kind of treatments they have done, they have taken. We can see that nothing has helped them for a long time. Cure is a very distant this thing, but nothing has even helped, like just to make them stable in these kind of cases of bipolar mania, schizophrenia, some deep depressions, some suicidal mania, some panic disorders, anxiety neurosis, or some this disease of the children like autism. So nothing have helped those patients. And in homeopathy we have cure, but we have to see, we have to understand the way how we have to see the patient and how we can approach that case, what we have to keep in our mind while approaching such cases, because that is what is going to help us to cure such patients. So we have to give very keep a keen mind, keep an open mind when we are approaching such cases. So we will discuss the whole part of that mental diseases in the next class on next Wednesday. Today we have understood the importance of the dispositions, that why they are important, why the mind or the state of the disposition is important in choosing a remedy, not only in the mental diseases or the cases which are arising from such things, but in all the cases, whether it is a physical disease, whether it is an acute disease, because the mind and the state of disposition, they are already every time they are affected, and we need to choose a remedy which is also similar to that state of mind and disposition. So whenever, that is why whenever we are seeing the cases, we give importance to that part. We take, we have a different section in the case taking, that how the patient feels, what are their usual behaviors, how they act in the states of anger or fear, or when they are anxious, how they act in that thing, because that all tells us about the state of the mind of the patient. So keeping that in mind, just go through these aphorisms again, so that, because it is a characteristic symptom in homeopathy. When we are prescribing, we are just searching for the characteristic symptom, and it is the biggest characteristic symptom which is always present and is always in front of us. It is always in front of us. You don't need to go into the study of psychology to understand that thing. You don't need to study something separate. You just need to see the patients with a very keen interest in how they are behaving. Once you start paying attention to how they are behaving, how they are telling the things, how, what are they doing, what are they doing when they are at home, how their their social relations with the other people, and you will start understanding the disposition of the patient. You will start understanding the mental picture of the patient. You don't need to understand it in a very deep manner, but yes, a general picture, how they are, only that can give us an insight that okay, this can be this remedy, and he cannot, she cannot be these remedies. So from there the clarity of the case starts coming. Okay, But that also does not mean that it is the only important symptom. It is an important symptom along with the other important symptoms which belong to the generals of the patient, which belong to the particulars of the patient. So there also we have the characteristic symptoms. But yes, when we are talking about the mental diseases, it will be more in the state of mind. So when we are going to cure, we will talk about it in detail next time. So we have to understand how the patient has been behaving since he has become sick. So just go through these aphorisms once again, and if there is any problem, anything which was not understood, we can discuss it again in the next class. So till then, thank you and good night. Good evening to all of you. So today we will continue with our organon series. There is a question regarding the local diseases. The question is freckles or melasma the hyperpigmentation on face local diseases? If yes, doing laser to treat hyperpigmentation or these kind of lesions, to remove these lesions on face, is it harmful? Okay. So when we started with this particular part of the how the treatment should be done, this local diseases, they come under the heading of one-sided diseases. So we have basically two kinds of one-sided diseases. One is the local disease, and one are the mental diseases. Okay. So when we started with it, so the first thing is one-sided diseases. What are the one-sided diseases? Diseases where there is paucity of the symptoms, where we do not have much symptoms, where we do not have enough symptoms to prescribe on. We don't have much characteristics. We don't have such symptoms in the generals or in the peculiars where we can prescribe. There we say that the disease is a one-sided disease, where all the disease is basically concentrated on one organ of the body. So in that case, then there is a subdivision of that one-sided diseases, which is the local diseases, where the diseases are basically concentrated on the organ of skin. So coming to the question, if this kind of symptoms, for example, this melasma or this thing, it comes in this category where that there is no other symptoms in the body, no other characteristic of the disease, like for example, no other the symptoms of the gastric system, respiratory system, or you do not find the disease where it penetrates the other tissues or the organs of the body, then we can call it a local disease. Then that discoloration, then that melasma, then that kind of freckles, they are basically one-sided disease, a local disease. Although not troubling, although not giving any kind of much trouble, or they're not some kind of the things which are painful or this thing, but still they are present, we can call them the local diseases. But if these kind of symptoms, they're coming up with other symptoms, for example, there are symptoms of liver, some problems with the liver, with the indigestion, with some kind of um, dyspepsia or something like this, then they can be associated with those kind of problems, or they can be part of the original sura which is running through the body, but then they will not be in the category of one-sided diseases. Although that is a local symptom, although that is a symptom of the skin, but we will not call it a local disease. We have to understand this difference. Okay, the symptom is of the skin, but we will not call it a local disease, or we will not cure it in the way where it is said, like we have discussed in the last part. We have to see all the symptoms, whichever remedy is being given by all the symptoms, we have to prescribe that along with the characteristics of that skin symptom if there are any. But if we are in those kind of diseases also, if we are looking only at the characteristic of the lesion, only at the characteristic of the skin, what kind of discoloration it is, the color of the discoloration, and giving or prescribing only on that part, then that is not fair. Then that will not be a homeopathic prescription. When Dr. Hahnemann has started with these aphorisms of one-sidedness, the first thing is that he said is that when the symptoms are not much, we only have one or two symptoms, and those are the only symptoms which basically tell us about the disease which is going on in the body, and we are kind of helpless there to just prescribe on that. And even he says going further that it can go into two things. Two things can happen: either that will be cured from there, it will be gone, the patient will go into healthy state, or the symptoms which were lying or which were in a latent stage, they might come up, and then we will have to come up with a new remedy which basically is equivalent to those symptoms, which is similar to those symptoms. So understanding of this thing, yes, the melasma or this thing, they basically belong to the skin part. They are local symptoms, but they are not only a disease when it is coming in conjunction to the other symptoms in the body. Okay, so we cannot just prescribe on that part, because in actual local diseases, when we are not having much of the symptom, we have to find the characteristic of that lesion on the skin. We understand that lesion, we try to find out the characteristic of that lesion, and we prescribe accordingly, because we don't have many other symptoms of the journals. Or if you ask about the sleep, everything is good. If you ask about the appetite, everything is good. If you ask about the mental journals, physical journals, or any other particular peculiars, you don't find anything in that. So yes, then we have to see what are the characteristics of that local disease on that part of the skin, and we have to prescribe accordingly. But in such cases, if there are many symptoms in the rest of the body, then it is not homeopathic to prescribe on only one single symptom, whether it be on the skin, whether it be on the any other part. We have to see the patient holistically. We have to see where the disease has permeated, and we have to understand the whole phenomena and then prescribe accordingly. Okay. So to the second question, whether the treatment of laser, is it justified? See, the problem with the hyperpigmentation is only this, that the people, they don't feel good about it. It does not cause any trouble to the patient. It does not cause any kind of dis-ease. Means it does not produce any kind of discomfort, except from the fact that we have this concept of beauty in us, that if the skin is clear, then only we look beautiful, then only we look good. So it is more of a mental state which is causing us in a state of disharmony. It is more of a concept which is causing a disharmony. Otherwise, there is these kind of, even if they come, they are very silent symptoms that don't cause any trouble to the patient, except from this. Okay, so I think the patient, they should be guided about it. They should be told about it, that it is okay, and the color of the skin, it changes, it can go. Okay, if it is a part of some major disease, we will get to that disease, we will try to cure that disease, and with that disease, these symptoms might go away. If they have just come because of some other reasons, I will not say that it is in a state of they may come, they may not come. But yes, going for the laser treatment just because of that concept is not right. And yes, it can suppress and can create any other kind of deep seated diseases, because it is a symptom which has been caused by the body. But like we have discussed also, that whenever the body is taking a route of local disease, what it is trying to do is, see, there are two one-sided disease, there are two categories. The one is the local disease and one is the mental diseases. If we look at the patients, If we look at our medicinal system, there are two diseases considered to be most difficult to cure. Two diseases. One are the skin diseases and one are the psychiatric diseases. They are most difficult to cure, manage, or treat. Because once they come, and then, there are very few, or almost kind of, we can say there is no other treatment for them. You can manage it, but they will come back again. There might be some periods with the sedatives or with local ointments or some kind of steroids in the local diseases. Once they are stopped, they will come back again. So these are one of the most tedious diseases in the whole array of diseases, if you say. And why? The reason why? Because the vital force, the intelligent vital force, it basically is trying to protect the body from complete destruction by keeping the diseases as one-sided diseases. There is a threat to the body that if this disease spread, then it can cause that sora, if it spreads, it can cause a complete destruction of the whole economy. So what the vital force is trying to do, it is trying to keep that disease in a one single organ of the body to protect the rest, either on the skin or on the state of mind. We'll go to those aphorisms also. And it was a very common phenomena nowadays because of the this some diseases, some equipments which have come in the medicinal field, that we don't see much of these kind of things happening. But earlier it used to happen when the patient was, like kind of, they used to tell that, that we doctor used to tell that we cannot do much for this patient, so let him go on his course, just you can just serve him in this state, rest whatever could be done we have done, and we cannot do more. So there were many cases at that time that suddenly a life threatening disease, some, like for example, a woman is in a child in the labor, or she's just on the state of, kind of, that she might die or collapse or something. Suddenly those people, they will go into states of manias. Some patient who is suffering from a very bad lung disease, suddenly he will go into a state of mania or some rage or very severe melancholy, and the whole disease will go away. Even Dr. Hahnemann talks about it in the, we'll talk about it when we'll go with the aphorisms. So when you look at that in that way, many times when you take some strong medicines, some strong allopathic medicine or some other medical medicines, it may cause a side effect in a form of, some skin rashes or allergies. Again, it is a very common thing, because whatever that thing has caused in the body is trying to throw it out. It is trying to take that disease, that medicinal disease, outside of the body and trying to keep it on one of the external organs so that it does not permeate inside, it does not invade inside. So that is why these two diseases, they are very difficult to cure, treat and manage in the current medical system, because they are like a very strong defenses of the vital force where it is trying to save the life. So if we are doing some kind of treatment, we are, going against it, then it might produce some more severe symptoms inside. And definitely these kind of laser treatments, they might have some kind of very bad effects of the laser also. And also if these kind of things, they get suppressed, then they can produce some inner disease, which can be then very difficult to be cured. So we will start with our aphorisms. So we have done till aphorism 214. We'll start with aphorism 215. So till 214, we have discussed about the mind and the disposition, and that how and why they are important in our prescriptions. We'll start with the 215. almost all the so-called mental and emotional diseases are nothing more than the corporeal diseases, in which the symptom of derangement of mind and disposition peculiar to each of them is increased, whilst the corporeal symptoms decline. So Dr. Hahnemann is saying that whatever diseases we are calling as mental diseases, emotional diseases, nowadays we are calling them the psychiatric diseases, they are nothing more than the corporeal diseases. They are just the physical diseases. They are nothing more than that. The difference is that in this part, in which the symptom of derangement of mind and disposition peculiar to each of them is increased. The only thing is that in this particular case, the same derangement of mind and disposition, which is seen in almost any disease, which we have discussed in the past few aphorisms, that every disease, whenever it comes, it produces some kind of mental changes or some kind of changes in the disposition of the patient. So we see that kind of change. So in this case, when we call the mental disease, it is nothing special. Just only thing is that the disease is more peculiar or more spread in the organ of mind and the disposition. It is more increased there, whilst the corporeal symptoms decline. So the corporeal symptom, the physical symptoms are declining, and the disease is shifting to the mind and the disposition. The symptoms of the mind and disposition are increasing more or less rapidly. So either it is in a slow pace or it is in a more quicker pace, till it at length attains the most striking one-sidedness. And it happens till it takes a striking one-sidedness, almost as though it were a local disease on the invisible subtle organ of the mind or disposition. So what happens is that a person was suffering from a disease from a long time, or other symptoms, for example, many symptoms there were, and they were slowly and slowly shifting towards the organ of the mind and the disposition. If you see the patients who are having some kind of schizophrenia, bipolar mania, some severe depressions or panic disorders, or some anxiety or some rage, if you look at the history of these patients, these kind of symptoms they usually are having from a long time. Not this much intense, but yes, if you look at very closely, if you inquire about these kind of symptoms very closely, then you will find, like yesterday I had a patient who has panic disorders. So when I asked them that, is there a definite time when you started having these panic disorders, he said that from recently, from 1.5 year or 2 years, the words are that severity has increased. Their severity has increased, but I have always been like this. I have always been a fearful person right from my beginning. I used to think a lot about something which used to make me afraid. So it is not something that has come suddenly. It has been there, a part of them, along with some physical symptom. It has been going from a long time, and these physical symptoms over a time of period they have been declining, and this mental symptoms they have been increasing. So we see a shift in this kind of diseases, in the mental or emotional diseases, that a shift has come from where the physical symptoms have decreased and the mental symptoms have increased. So again, it gives us a perspective or an understanding that when we have to cure these kind of diseases, like we always talk about, that we have to understand the phenomena. So we have to understand the whole phenomena, how this disease has developed. So it is not something one or some causation which has happened 1.5 year back or 2 years back. No, it has always been a part of that patient. So we have to understand that thing. 1 year back, 2 year back, 3 year back, when it has become more severe, something might have happened. But that was more of a thing which aggravated the thing which was already there. So it was not a cause which has been a fundamental cause for that thing. It might be some aggravating cause, but that does not become important in such cases. What becomes important is that how he has been through his whole life. We will talk about that in more detail when we go to that aphorism. But to understand this, that it is, we have to understand that there is a shift of physical symptoms to this state of mind and disposition. So 216, the cases are not rare. Like I was telling you that it used to, even nowadays it happens, these things. The cases are not rare in which a so-called corporeal disease that threatens to be fatal, a suppuration of the lungs or the deterioration of some other important viscous or some disease of acute character, for example in childbed, etc., becomes transformed into insanity, into a kind of melancholia, or into mania by a rapid increase of the psychical symptoms. So Dr. Hahnemann is saying that it is not rare, it is frequent, okay, that some diseases which were life threatening, like there was some thysis of the lungs, some pneumonia, some suppuration of the lungs, or some other destruction of some important organ, which becomes suddenly transformed into insanity, which suddenly transforms into some kind of deep depression, some kind of mania, where the psychical symptoms, they are increasing, that were previously present. Again, the same thing. The symptoms are not new ones. It is not that some new symptom has come up. They were always there, but in a very subtle, in a very low intensity or mild intensity, they were always there. If a patient has gone into some severe depression, sadness, melancholia, there used to be some bouts of sadness earlier also. The patients were sad patients earlier also. But now they have suddenly gone into that state, whereupon the corporeal symptoms lose all their danger. And when this shift happens, when this rapid increase of psychical symptom happens, the corporeal symptoms, which were the physical symptoms which were life threatening, they lose all their danger. They become very mild, they become very less in their intensity. These later improve almost to perfect health. It appears many times that these symptoms, as if they were never there. If some mental diseases of a very, very long, has been happening from a long time, the attendants, the people who have been with them, sometimes they even don't remember that they had any kind of physical disease. They will always have, physically he is fit, very strong physically, never had even a fever, never even had some cough, never had any coryza, because that all is shifted to that state. So these later improve almost to perfect health, or rather, they decrease to such a degree that their obscured presence can only be detected by the observation of a physician gifted with perseverance and penetration. Or they become obscure, or they decrease to such a degree that only a physician who is gifted with perseverance and penetration, who has a very strong observation, who has a grit that I need those symptoms, I need to ask about them, I need to find them, then that kind of physician can see that yes, these symptoms are still there to a very small degree, they have not completely gone, but they are still there. In this manner, they become transformed into a one-sided and as it were a local disease in which the symptoms of the mental disturbance, which was at first but slight, increases so as to be the chief symptom. So that whole problem, it's basically transformed and shifted to a local organ of mind as if it were a local disease. And then that symptom became the chief symptom instead of some physical symptom which was very strong earlier, and in a great measure occupies the place of the other corporeal symptoms whose intensity it subdues in a palliative manner. Again, very important word, palliative manner. So it takes place of the other symptoms in the body. The whole, like I told you, that whole disease gets concentrated to then that one particular organ, and we call it a local disease. And why it happens? To palliate that. It happens in a palliative manner. It has palliated those corporeal physical symptoms, not cured, they are not gone, but they are in a palliative state. So that, in short, the affections of the grosser corporeal organs became, as it were, transferred and conducted to the almost spiritual, mental, and emotional organs, which the anatomist has never yet and never will reach with his scalpel. So the whole the physical phenomena, the whole phenomena of the disease, it is transferred to that invisible spiritual, mental, and emotional organ of mind. Dr. Hahnemann says that it is such an organ where the surgeon or an anatomist can never reach with his scalpel. That is why it will be not able to cure that part, that disease, by the methods which we are commonly seeing. They can never help that patient. So in these diseases, we must be very careful to make ourselves acquainted with the whole of the phenomena. So the first thing which we have to do is we have to be very careful. Careful in what? In understanding the whole phenomena, both those belonging to the corporeal symptoms and also, and indeed particularly, those appertaining to the accurate apprehension of the precise character of the chief symptom. So the first thing, we have to be very careful in understanding the whole the phenomena which consists of the physical symptoms which were there, and now it has shifted to the other part of the brain. But like Dr. Hahnemann will also tell this thing, but somewhere they will come back. You will always see those physical symptoms coming back whenever the mental diseases, the symptoms have and the intensity has decreased. You will see those physical symptoms sometimes coming up in some kind of seasons, in some kind of situations, in some kind of uh, uh, when the patient is in a more stable mood or in a more stable mental state, so those symptoms will come back, although minutely, although for a less time, but they will come back. And if we have this understanding that we have to look for them, then we will indeed see those symptoms. And if we ask also to the attendants, uh, and many times the attendants, they tell about those symptoms. So those appertaining to the, and the second part is first the corporeal symptoms, and then particularly accurate apprehension of the precise character of the chief symptom, of the peculiar and always predominating state of the mind and disposition. So now the chief symptom is the state of the mind and disposition right now. That has become the chief symptom in these cases. So a physician has to understand the peculiar character of that. For example, if a patient is suffering from some kind of delusions, so we have to characterize it. What kind of delusions are there? Okay, is there some particular underlying theme of those delusions? If the delusions are ever changing, they are of no use to us. Okay. But yes, if there is some underlying this thing, for example, there was a case I have discussed. I think most of you have heard about that case, a case of Lekes's patient who used to hear, he used to have auditory delusions. He used to hear that someone is scheming against the country. So he will go to the police, he will go to the CID and tell them that, I can hear, I have this power, I have gained a power by which I can hear their satellite communications. The people, they are trying to attack in some part of India, and I can hear them. So he would say that now they have come to know that I can listen to them, and they are threatening me. They are saying that we will kill you if you tell to the police or you tell to the army. So he used to go everywhere to tell everyone that I have these kind of this thing. So that auditory delusion, that becomes a very characteristic part of the chief symptom. So similarly, if there is some kind of confusion of mind with that, any kind of dullness of the mind, or if there is some kind of anger, then how the person is behaving in that anger. If a patient is suffering from some kind of panic attacks, then how is the usual mood with that kind of anxiety? Like one of my patients again, he used to have a very severe hypochondriasis, very severe. Like every month he used to do some MRI or some scanning of the body. He always had that, this fear that the doctors are not able to understand. He used to feel this pains around this area, in the back. sometimes in the cervical region. And his mother had suffered from cancer. She died from the cancer, and that had a huge impact on him. So he used to do lots of tests, echo, ECGs, MRIs, and whenever he would do, he would be in this thing. He will always become very sad. He would weep also. Okay, so hypochondriasis, it is a chief symptom. Anxiety or this fear of disease is a chief symptom. But the characteristic was that whenever he was into this state, he would become very sad, very depressed. He will not talk with anyone. He will be silent. He does not want anyone to talk with him. Otherwise, he was a very extrovert person. Otherwise, he would like going out with the people, like doing his work, his job, very sympathetic, very generous person. And he would all like, after he became well, he would always tell me, doctor, we should start a camp for the children which you are doing. We should start in this city, we should start in that city. Always very enthusiastic to help others, and animal lover, very this thing. So, but he had this character. Whenever he was into a state of hypochondriasis, he would be very sad and does not want to talk with anyone. He used to have pigeons, which he loved very much, which he took care of a lot. And at that stage, he would even stop feeding those pigeons. He would stop looking at his dog. He would stop taking him out for a walk. And he would be in a very, very deep, sad state. And this is a very characteristic of phosphorus, this particular part. Phosphorus we usually do not think about when we go into this hypochondriasis, but it is one of the main remedies when this kind of state happens. And whenever they're in a state of hypochondriasis, they go into such very, very deep sadness. A very, jovial person, a very happy person, a person who has lots of energy, and going into such state. And he is completely out of that state now. Even now, if he sometimes gets symptoms, he does not bother about that. He completely, even he would not even go out of the city at that time. That if I had a symptom there, then my doctor, how will I contact my doctor? How will I contact him? How will he give me medicine? Because he was taking the homeopathic medicine. He had a belief in homeopathy and me. So he would say that, doctor gives the medicine from his clinic. It is not like allopathy that I can take it anywhere. So how he will give medicine? So his son has been calling him to Australia from past 10 years, and he did not went there. He did not went for his graduation. He did not went when he started his job, because he said that I cannot come. If I get sick, then who will give me the medicine? And recently, after getting better, he has gone 3 times to Australia. 3 times for 1 month, 1.5 month. And now I sometimes jokingly ask him that now you are going to Australia. If you get some problem there, how will you manage? I jokingly ask him. Yeah, don't worry. I will just call you. I will just call you. So, so we have to understand the whole phenomena. This characteristic of the chief symptom and the corporeal symptoms which they used to have, or which sometimes comes now also, in order to discover for the purpose of extinguishing the entire disease. So, among the remedies whose pure effects are known, a homeopathic medicinal pathogenetic force, that is to say, a remedy which in its list of symptoms displays with the greatest possible similarity not only the corporeal morbid symptoms present in the case of disease before us, but especially this mental and emotional state. So it should not only cover the medicine which we are selecting. It should not be only similar to the morbid symptoms of the corporeal character or the physical character. Not only the physical disease symptoms should be covered, but especially this mental and emotional state and its characteristics. Okay. This finding of characteristic is very important, because, for example, all the patients who are suffering from, if we name it, if we go into the name of the disease like schizophrenia, everyone is suspicious. Everyone is suspicious. So suspicion is a very common thing among such patients. But we have to understand that there is always some characteristic to those kind of things. We have to find that characteristic. What change happens into them when they are into that state? Is there any characteristic? Is there any characteristic in their behavior which they usually do when they are into, for example, a patient, a person who is suffering from some kind of anger disorders, some rage or something. Whenever he goes into he starts abusive. He starts becoming abusive. Although he's not, especially when he's not from that kind of background, familial background, like a person, and there was this patient, he was a teacher in a university, and he comes from a very decent and a background which is very manneristic, like his father was a teacher also, mother was also a teacher, and they were at very good posts, and this person is also a very good post. And when you inquire about him, that has he been like this, like abuse, everyone will say that this is a completely different person. He was a very subtle person, talking very carefully, seeing how the state is managing, how the things are in a very responsible way or in a very beautiful way. And suddenly such a person, when in anger he becomes abusive, that becomes a very characteristic thing. So that becomes a characteristic of that mental and emotional state. And our remedy, along with the physical symptoms whichever there are, we have to we have to form a picture and find a remedy which basically corresponds or is similar in greatest possible meaning to that particular picture. So aphorism 218, to this collection of symptoms belongs in the first place the accurate description of all the phenomena of the previous so-called corporeal disease. Like we have discussed, that all the phenomena from where this disease has shifted to the mental disease, the phenomena of that disease, that physical part, it has to be accurately described, has to be accurately understood before it degenerated into a one-sided increase of the psychical symptoms and became a disease of the mind and disposition. This may be learned from the report of the patient's friends. Okay, so this we may learn from the patient's attendants or friends or the family members. A comparison of these previous symptoms of the corporeal disease with the traces of them that still remain. So once we have asked from the parents or the attendants or the friends of the patient that what were the physical disease which was before this state has come, and now if we compare with the traces of them that still remain, so like I told you earlier also, that there will be some symptoms which will be still there, though they have become less perceptible, they have become very less perceptible, they have become less prominent, it is difficult to see them or analyze them, but which even now sometimes become prominent. When do they become prominent? Even now, when a lucid interval or a transient alleviation of the psychical disease occurs. Transient alleviation means a small amelioration. Whenever the psychical symptoms they are ameliorated for a small time by the situations, by some kind of something which is according, something is going according to the patient is happy, there is little alleviation, amelioration of the psychical disease, those symptoms they will come back, they will become prominent. Some kind of diarrhea, some kind of changes in the, for example, the same patient who was, like I told you, who had this auditory hallucinations. So there were some bad days, there were some good days. On good days, whatever was his coryza will come back. He will start having this cold, you know. So will serve to prove them to be still present, although obscure. Okay. So this also tells us that those symptoms are still present. They have not gone anywhere. Like the Dr. Hahnemann, he used the word that they are basically in a suppressed state. They are not gone anywhere. They are still there. They are still the part of the disease. So it also gives us a relation that whenever the psychical symptoms increase, the physical symptoms decrease. And whenever the psychical symptom decrease, the physical symptoms they come back. So they are basically so much interrelated with each other, and they become a very they make a very characteristic picture of finding a simillimum remedy. So that is why we have to become acquainted with the whole phenomena of this physical disease which has happened or which has been happening before it shifted into this part. And there was this one more boy who used to have suicidal disposition, suicidal thoughts. So similarly in his case also, whenever he will become a little better, he will have very severe headaches where he will start becoming more confused. He will become more dull. He will be not able, for example, if he was studying in the college, so when if he had this exams, and he will become very confused which exam is tomorrow, like which I have given, which I have to give. He will become confused in them. So this was very characteristic of that patient. So by adding to this state of the mind and disposition accurately observed by the patient's friends and by the physician himself, we have thus constructed the complete picture of the disease. So by adding the state of the mind and disposition to this part, to this characteristic of the physical symptoms, or which are still there, we have completed the picture of the disease, for which in order to effect a homeopathic cure of the disease, a medicine capable of producing strikingly similar symptoms and especially an analogous disorder of the mind must be sought for among the antisoric remedies if the psychical disease have already lasted some time. Okay, so out of them we have to find an antisoric, we have to find a simillimum remedy which is basically simillimum to the disorder of the mind, to the state of the mind, and to the physical picture of the disease which preceded, which was there before this disease came, this mental disease came. So this is the idea about the how to deal with this mental diseases, because without considering this whole thing, we will never be able to treat the patient, and this is a key. If we suddenly go and give stramonium, belladonna, and veratrum, and hyoscyamus, or these kind of remedies, we are just looking at the mental picture and ignoring the physical phenomena which had been running behind it. So that is why these kind of remedies, they don't give a permanent. They might again ameliorate certain symptoms. For example, you give stramonium, it will ameliorate certain symptoms of the patient. You give belladonna, it will decrease the anger for some time, but it will come back. So it again acts in a palliative manner, because we have not considered the thing which had been there before this disease has come up. And moreover, at least in understanding a general state of mind, when we look at a patient that okay, he's suffering from uh, some kind of sexual mania, erotomania, he's suffering from that, at least we can rule out the remedies which don't belong to that stage. So just the understanding of this thing, that what kind of a general state of mind is going on, like we were discussing last time also, that rule out basically happens when you know that what kind of general disposition is of the patient and what kind of the general disposition a remedy possesses. We have done that footnote to the aphorism that Nakswamika will never be uh, able to cure if the patient is of a yielding disposition. So whenever patient is yielding, we know that we have to rule out all the remedies which are predominantly obstinate. So similarly in this state also, when you see that a particular kind of mental state is there, we can rule out all the other remedies which do not have those kind of states commonly or generally. So if a patient is suffering from melancholia, at least we will have this thing that we should not give belladonna, stramonium, or veratrum in such cases, because they don't have this kind of state of the mind. Okay. So we will stop our lecture today here at aphorism 220. I will again request you to go through this. These kind of diseases, homeopathy is the only answer in today's time. You all have experience in homeopathy, in the medicinal system. Many of you are doctors who have been practicing from long time. You have seen such cases, how they have been suffering from so long. And at least we know that there are no other medication, because the medicines, other medicine, they're not working in this way. They're not trying to go through the patient or understanding the patient in this way. So that is the first reason why those medicines, they don't have that power to cure the patient in a complete manner as it is meant to be, for a longer period, for a permanent period. Why these medicines, they are not able to help? They can help for some time, they can manage the patient, yes, they can help with that thing. But when our aim is to bring the patient back to health, then we should go with that mindset in such cases. So we have to go through these aphorisms, because these kind of diseases are on the increase. The reason that the physical phenomena are being suppressed in a more rapid way by many kind of treatments which are going on nowadays. So we have a rise in these kind of diseases in recent times, and we have to understand that we are the ones that can help those patients. So we need to understand it in a more deeper way, that how we can go about these things through our, now like I told, and these all things are given in our materia medica. If we can understand the organon, if we can just understand this part. Now, after understanding of these particular aphorisms, when you go back to materia medica of phosphorus, you will find the same thing which I have told you today, because it is written in the materia medica. But we didn't had a mirror to look through earlier. Organon helps us like a mirror. It helps us in searching like a magnifying glass. It helps us to search what we are looking for in the materia medica. So now if you go to the phosphorus, you will find these things which I have said today in the materia medica of phosphorus. Because now you know that, there is some this similarity which is there. There are some peculiars which we have to find in the mental and dispositional part of the patient. And now you can hit upon that thing. So when you go through these aphorisms again and again, you make a link. You go through the aphorisms, organon, you go through the materia medica, you go through the aphorism, you go through the materia medica, you start forming a link. And that link is what transforms into our case taking, into our analysis, and into our search of remedy. If I am reading materia medica with one mind, and the organon I have never gone through, or just few aphorisms I have gone through, I have not formed a link between these things, then it becomes very difficult. And it becomes very difficult to understand miasms, because nowadays, like recently when we had been in Thailand, I have talked about syphilis when we were discussing Merck. So recently, from past few years, I have been I have few cases which have responded to that kind of anti-miasmatic treatment. I will not go into detail right now. It is a long thing. Where the problems they have developed from syphilitic miasm, the syphilitic miasm which Dr. Hahnemann has told us about, which is linked to the venereal diseases. Because when you have to form the link in all the things which are homeopathic, all the homeopathic literature, you have to go through them again and again. And when we are doing these classes, when we are doing these lectures, we have a 1 week period in which we can go through them once or twice, try to understand, try to, make a link with the previous aphorisms, try to make a link with whatever we have talked, try to make a link with the materia medica. For example, if you go to the lachesis part of the materia medica, you will find these kind of characteristics there. If you go to the sulfur materia medica, you will find those mental characteristics there. And if when you will see that in the patient, someone who is suffering from those kind of psychiatric diseases, the immediately the remedy will hit your mind. The remedy will hit because now you know the aphorisms. Now you know what you are looking for in such cases. Earlier we were just, kind of throwing the darts in the dark. We didn't know what to hit. Everything, we didn't know what is the target. We do not know. So organon, these aphorisms, they give us a way how to proceed in such cases, how to understand our materia medica. So now whenever now you go through the materia medica, if there is go after this, go for the materia medica of Mazerium and Dr. Kent's materia medica. Just read Mazerium and see how he tells that those skin symptoms, how they change into something more drastic, something more bad. All the materia medicas have, pointed these kind of changes. What happens after this? What happens after this? We were not able to establish that link. Then if you go to the Mazerium, you will start understanding that indifference part of the Mazerium, how it is developed and how violent it is. So when, because like I have told you that you cannot memorize materia medica, it has to be understood. So these aphorisms, this organet helps us in understanding the materia medica, how it is to be understood. So just now you just go give a reading to Mazerium. It is a very small, I think 3 or 4 pages max. You can just do it in 15 or 20 minutes. Try to understand, try to see this link in that remedy. And then you can, make up your mind that, okay, if a patient comes with this kind of condition, who has come from this kind of state, Mazerium is the remedy. And I'll wait for the such kind of patient to come. And whenever he comes or she comes, I'm going to this remedy and I will see that beautiful cure happening in front of my eyes. Okay. So first go read the Mazerium, feel about how you have understood this thing, you know, keep that thing inside, think about it, and then you go back to those aphorisms and then read them again. And you will have a more clear picture about what we have talked today. So with that, good night to all of you and thank you very much. We will start where we left last. I think we have done till aphorism 220. So we were doing this mental diseases, the one-sided diseases. So we'll continue with that part. So till now, Dr. Hahnemann has given us a basic principle on how to deal with the mental diseases, the psychological disorders. He will give more finer points in the coming 10 aphorisms. We will try to do from 221 to 230 today. 10 aphorisms we will try to finish. And he will give some fine points on how to deal with different kind of diseases in the same group, in the same mental diseases part. So we will start with aphorism 221. So if, however, insanity or mania, so we have been doing all those the reasons for the psychological psychiatric diseases, how the mental diseases they come up. So till now we have understood that there is somewhere a physical phenomena, a phenomena of the physical disease, which has transferred to the organ of the mind. So it has been a process which have been going on from a long time. There have been few symptoms which have been seen regarding this phenomena, which may be part of disposition, which may be part of behavior, and they have now increased in this specific mental disease. Then we come to the second part. If, however, insanity or mania caused by fright, vexation, or the abuse of spirituous liquors, etc., have suddenly broken out as an acute disease. So in some cases, this insanity or some kind of mania, it can also suddenly break out like an acute disease, because of some kind of causations where there can be fright, where there can be some kind of anger, where can be some kind of excitement. Because of that, sometimes this acute episodes of insanity or mania, they may break out in the patient's ordinary calm state. So I can recall a case of one of my known people. She works for me in the and this. Suddenly, I got a call from the clinic. I was on a holiday. It was a Thursday, so I had not gone to my clinic. So suddenly, I got a call from one of my assistant doctors that this particular person, she has gone into some kind of attack, into some kind of episode where she's not able to listen. She has just closed her eyes and she has started scratching herself. So there were two or three students who managed to get her and this get her on the sofa. They made her lie down, and where then I reached the clinic and I saw that she, her eyes were closed. She was doing and she was scratching herself continuously, the whole body. She was scratching herself. So out of nowhere, the student, they told me that we were just talking and suddenly this thing started. So even some kind of mental disease or some kind of delirious states or some kind of insanity or mania, they may also come in the acute states. So what we have to do at that time is, although it almost always arises from the internal sora, the cause is the sora, no doubt, but it comes like an acute disease, like the other acute diseases also. When we have done this portion of the acute diseases, where we have done that sporadic one or the individual ones or those things, they all arise from the sora. The cause is always sora, but it is like a first time, or it is like sometime, a long time before it has happened and now it is happening. It comes like an episode. So like a flame bursting forth from it, yet when it occurs in this acute manner, it should not be immediately treated with antisorics. So what is the important thing to understand here is that when it comes like this, like any other acute, the way we approach the other acute diseases, it should not be treated with the antisoric or a constitutional medicine. We have to see what are the current symptoms, what is the characteristic of a current symptom, and then we have to prescribe accordingly. But in the first place, with remedies indicated for it out of the other class of proved medicaments. For example, aconite, belladonna, stramonium, hyoscyamus, mercury, etc. So we have to treat it as an acute disease, and whatever state is being present, like in that girl, there was this scratching, which was she was doing, and this is a very characteristic state of belladonna. Now that person, she is not belladonna in a constitutional state, but that acute state was agreeing with that picture of belladonna. So she was given belladonna. We rubbed on her wrist, around her mouth, and I think within few seconds, she started coming back to her conscious state. She stopped doing that thing. She started, coming back to that state within few seconds. So, in highly potentized, minute homeopathic doses, in order to subdue it so far that the sora shall for the time revert to its former latent state. So, what we are doing is we are giving an acute remedy in such a state so that we can take back the patient to that former state of sora. This medicine is not going to cure sora. This medicine is not going to cure her completely. But yes, she will be sent to that latent state, the latent state of the sora. So to its former latent state, wherein the patient appears as if quite well. Now, Dr. Hahnemann, like I told you, that he chooses his words very carefully, wherein the patient appears as if quite well. That is the latent state of sora. When we appear, everyone appeared to be quite well. We appear, we are not well. That is not a state of health. There is a latent stage of sora which is going on. And Dr. Boeing Hassan, he basically writes a very beautiful line in his lesser writings. He has, in one of his essays, that this latent state of sora is the state where the mental symptoms are more prominent. The behaviors are formed, the habits are formed, a kind of disposition of a person is being formed in this latent state of sora. So it just shifts. It shifts to the other part. So because there are no physical signs, no physical symptoms, the journals are good, we don't feel anything, so we say that we are healthy. We are in a state of health. But a good physician, a good homeopathic physician will always know that no, this is not health. If something has disappeared completely and not gone into something more, sorry, in a lesser form, then that means that he is not cured. It has just gone to the latent stage of sura. That is why it is very important. Like I have been telling this a long time. When some symptom disappears, where does it go? We have to understand that thing. Where has it gone? If an epilepsy has suddenly stopped, where has it gone? If someone was having some pains, some very bad pains, and they suddenly stopped, where have they gone? They should always go into a more, lesser symptom in a lower stage of the disease. Like, for example, epilepsy gets better and some rashes start appearing. Then we are okay. Okay. Some old symptoms, they start coming up. It is good. But then if it disappears and nothing is coming, that means that it has gone to that latent stage of sura, from where it might come with a more forceful or powerful symptoms as compared to before. So now what we have to do when they go to the latent form of the sura, aphorism 222. But such a patient who has recovered from an acute mental or emotional disease by the use of these non-antisoric medicines should never be regarded as cured. We should never ever regard that patient as cured. The same thing was told when we were doing this acute diseases. That if you have given a medicine and the patient symptom have disappeared, don't regard it as cured. On the contrary, no time should be lost in attempting to free him completely by means of a prolonged antisoric treatment. We should immediately start an antisoric treatment. A constitutional medicine should be given to that patient, and this treatment is going to be prolonged. It is not going to be like this. Some old symptoms have to come, which have to go then some more old symptoms or a more lesser uh, important symptom, they have to come and go, so that this patient can get rid of the sura from the chronic miasm of sura, which it is true has now become once more latent but is quite ready to break out anew. If we just leave it untreated, it might again break up with more violence, with more prominence. And it might be very difficult at that time to bring the patient back to that latent stage. If this be done, there is no fear of another similar attack if he attend faithfully to the diet and regimen prescribed for him. So if it is done, so then there will not be any fear of any similar attack. So the footnote to aphorism 222. It very rarely happens that a mental or emotional disease of long standing ceases spontaneously. So Dr. Heyman is saying that very rarely it may happen that some mental or emotional disease which have been going on from a long time, it suddenly disappears on its own. It very rarely happens. For the internal dyscrasia transfers itself again to the grosser corporeal organ, because for that to happen, the disease has to shift back to the physical organs. So this shift on its own, it happens very rarely. Such are the few cases met with now, and the where a former inmate of madhouse has been dismissed, apparently recovered. So, because even now there are some hospitals or some centers which take care of the psychiatric patients. At that time, at the time of Dr. Henneman, there were few asylum, these kind of centers, which took care of such patients who have been suffering from some mental diseases. And because there were no other medicines, psychiatric medicines were not available, or they were not in a very good amount, or the people did not knew about this thing, the research was not like that, so they had to be kept in those kind of centers for a long time, sometimes even the whole life they have to be there. So he's saying that from such kind of mad houses, from such kind of centers, There are very, very few cases where you see that a patient has been dismissed from that center and told that he has recovered. He had told, moreover, all madhouses have continued to be chokeful. He's saying that all such centers are chokeful, they are full, and no new admission can be done, so that the multitude of other insane persons who seek for admission into such institutions could scarcely find room in them unless some of the insane in the house died. So he's saying that they are so chokeful, they are so full that no, even if some new patient has to be entered into that facility, they will not get room there, and they can only be admitted if some old patient dies. Not one is ever really and permanently cured in them. So from his experience, he's saying that no one is basically permanently cured or really cured in these kind of centers. So he's basically telling us about the centers, the state of those centers, and the kind of treatment which was given to the patients at that time. A convincing proof among many other of the complete nullity of the non-healing art hitherto practiced, which has been ridiculously honored by the allopathic ostentation with the title of rational medicine. Because at that time, such patients, they were given electric shocks also, they were beaten also, they were given punishments also. So there were many kind of such processes or procedures which were done. And Dr. Hahnemann is talking about all those things, that this is not a medical art. How often, on the other hand, has not the true healing art, genuine pure homeopathy, been able to restore such unfortunate beings to the possession of their mental and corporeal health, and to give them back again to their delighted friends and to the world? And he's comparing that, on the other hand, when we see homeopathy, the medicines when we give in such patients, that their mental and physical health, they both recover, and they are basically uh, we can give them back to the family, we can give them back to the world, so that they can pursue their life, they can pursue whatever they want to do in their lives. So aphorism 223. What if the antisoric treatment be omitted? What happens if we don't give an antisoric treatment? If we don't give the patient the constitutional remedy after such kind of episode, then what will happen? Then we may almost assuredly expect from a much slighter cause than brought on the first attack of the insanity, the speedy occurrence of a new and more lasting and severe fit. So he's saying that if the antisoric treatment is not given, then we can expect that even from a more slighter cause, even from a much lesser cause, this kind of attack may come again, which will be more severe, more long lasting, during which the sora usually develops itself completely, because the sora in that latent stage is going to develop. And once it is going to develop, once it has got that power, then it will show or express it in a more severe and a more lasting way, and passes into either a periodic or continued mental derangement. Then it will become either an episodic derangement or a continued mental derangement, which is then more difficult to be cured by the antisorics. Okay, so like I was saying, that then it will become more difficult for us to cure that thing. So it is better that if such a patient comes to us, after such kind of episode, we have to start antisoric or these constitutional treatment immediately, although the patient appears to be in a healthy state. So if the mental diseases be not quite developed, and if it be still somewhat doubtful whether it really arose from a corporeal affection or did not rather result from faults of education, bad practices, corrupt morals, neglect of mind, superstition, or ignorance. So, like we have talked about it earlier also, that one are the diseases which are basically the true mental diseases, the true psychiatric diseases, which are coming from the corporeal affections. The physical symptom, they started disappearing, and suddenly this mental disease it started coming. And then some are result from our faults of education, the things which we have learned. For example, if in someone's family, the people they use abusive words, that they disrespect some the elders, or they disrespect people, and the child is learning that thing. So that is a fault of education. Some kind of bad practices have been going on. Someone is having some corrupt morals because he's seeing everyone corrupt around them. So neglection of mind or superstition or some kind of ignorance. Okay, so because of this thing also, someone might this come up with the some kind of habits or some kind of disposition, which we might feel that it can be a mental disease also. So but how to decide which is which one? So the mode of deciding this point will be that if it proceed from one or the other of the later causes. So if it is coming from some kind of fault of education, some bad practices, corrupt morals, from superstition, ignorance, if it is coming from there, later causes, it will diminish and be improved by sensible, friendly exhortations. So that can become better. It is just an education. You give a good education to that person and he can start becoming better. So when we give them some friendly advices, some consolatory arguments, we put some kind of arguments in front of them, some serious representations, and sensible advice, they will start becoming better. Okay. If someone is having some kind of for example, if someone is kind of in a habit of stealing. Okay, he just likes to take things which he like. So if he's suffering from the later cause, some bad education, if we make him sit, if it can tell that this is not thing, something belongs to someone, or it can give a pain to someone, that if you do things like this, and they start understanding that yes, it is a genuine thing which the person is saying, and they start getting better, then it is because of that faulty education. Whereas a real moral or mental malady, but if someone is a kleptomaniac, it has come as a disease to that person. A real moral or mental malady, depending on bodily disease, which is coming from that physical disease, which have been shifting to that part of the mind, would be speedily aggravated by such a course. That kind of patient will be aggravated by all these things when we are consoling them, when we are advising them, when we will tell them that this is because of the environment, or because of the education, or because of some things which you have not understand properly. So those patients, they will become more aggravated, they will not get better. So aggravated by such a course, the melancholic would become still more dejected. The person who is in a depression, who is in melancholy, if you start consoling him, they will become more sad. They will become more dejected. Querulous, inconsolable, and reserved. The spiteful maniac would thereby become still more exasperated. If there is some maniac, he will become more maniac when you are trying to calm him down. And the chattering fool would become manifestly more foolish. And if someone is speaking foolishly, talking foolishly, and you're just telling him or arguing with him that this is not like, he will become more foolish and he will argue more. So this is a way how to see which is the actual mental disease coming from, that shift of the sura, and which is because of the faulty education, because of something which he has picked up from his surroundings, which have been because of the superstition or some kind of ignorance. So this is a way how to make it, how to differentiate it. So there is a footnote to aphorism 224. It would seem as though the mind in these cases felt with uneasiness and grief the truth of these rational representations that acted upon the body as if it wished to restore the lost harmony. So he's saying that in these cases, which cases? The cases which where the shift has come from the physical symptom to the mental symptom, the true mental diseases, he says that there is a kind of uneasiness and grief, that these representation where the person is telling me these advices, they are rational and acted upon the body as if it wished to restore the lost harmony, but that the body by means of its disease reacted upon the organs of the mind and disposition and put them in still greater disorder by a fresh transference of its suffering onto them. So he's saying that in these cases, it feels that the mind, somewhere might be understanding, but the disease force is so strong. The disease which has shifted to the mental disease, it does not let those advices act on the reasoning of that mind, as if that disease has taken the the complete control of the reasoning and intelligence, and it is not letting all those things, all those advices, all those consolations to act on it, and it puts up a more suffering in the patient. The disease produces fresh transference of its suffering onto them. There are, however, as has just been stated, certainly a few emotional diseases which have not merely been. Now, third one are the emotional diseases. We are coming to that part. So, there are, however, as has just been stated, certainly a few emotional diseases which have not merely been developed into that form out of corporeal diseases. So, now these emotional diseases have not developed from the physical diseases. Okay, but which in an inverse manner, the body being slightly indisposed, originate and are kept up by the emotional causes such as continued anxiety, worry, vexation, wrongs, and the frequent occurrence of great fear and fright. So now there are some emotional diseases which are dependent upon what we have been going through, some kind of stresses in the life, some kind of uh, situations which are around us, some kind of things which have been happening in the past, or something which we are anticipating in the future. All those kind of things, they can bring out some emotional diseases in us. They are not actually developed from the physical symptoms, but it is in the inverse manner that these emotional diseases can basically start uh, damaging our physical health. So this kind of emotional diseases in time destroys the corporal health. So in a reverse manner, we have seen this many times. Like for example, there was some death in the family, the patient, they got grieved, the grief went much deeper in the patient, and after some time that grief started taking the whole economy and weakening the patient, the mind and the physical health of the body. And these kind of diseases, we call them as the emotional diseases, which started with some kind of emotion on the organ of the mind, and then it started destroying the physical health, often to a great degree. So it is only such emotional diseases as these which are first engendered and subsequently kept up by the mind itself, that while they are yet recent and before they have made very great inroads on the corporeal state, may by means of psychical remedies. Okay, so now what we have to do is that when we see a patient who has just started with this kind of emotional disease, suddenly something has happened, and we can see that this now there are two ways how we tackle with situations which are around us. Two or three ways. One thing is we get an emotional state, some kind of grief, some kind of anxiety. That thing is resolved. If it is of low intensity, it is resolved, or we try to resolve it. For example, there is death, we try to overcome that state, we try to manage ourselves by some kind of consolation, some kind of meditation, and we get out of it. The second is that the mind, it starts keeping it up, you know uh, because again it will come down to the same thing, that if it is happening, it will be because of the sora, because of the sensitivity of the patient. So if it is that the mind is still keeping it up, although everyone is giving that kind of advice, that kind of everything is there, everyone is there for the patient, but they are still keeping it up, keeping it in mind. So now we know that in such a patient, the physical health, if it keeps going on, the physical health is going to get destroyed, it is going to get affected. So what we can do is maybe by means of psychical remedy. The first thing is that we have to give some psychical remedy, such as a display of confidence. Again, that we should have confidence in that person. For example, if someone is feeling low on confidence, we show them that no, we are confident about you. That may provide confidence to the patient. A dejected person, he might find confidence from your confidence. some friendly exhortations, some friendly advices, some sensible advices, and often by a well disguised deception. Be rapid. Sometimes we also you have to, you know, use something in a disguised way, in a deceptive way, but for the good of the patient. Okay. Sometimes we have to give a fear to the patient to take away the other fear. Like, for example, recently, one of my patients, he was, you know, he was basically slightly worried about his health, that something is happening, what it could be. Tell me the test, tell me the test. He would always come to the clinic and, doctor, just tell me the test. What test should I do? And I just, because he was like, this is also like cures like, similia similibus currenter. Give him an extra fear. I said that, okay, you are so worried right now because nothing is coming in your tests. You are so afraid and you're so worried. What will happen to you if something comes up? Just think about it. If something comes up in that test, because right now nothing is coming in any of the tests. So if something comes up in that test, what will happen to you? And he was suddenly taken aback, that because he has not thought up to that level. If something comes up, then what? And suddenly he said that I will die on the spot. So I said that, why are you, trying to find a way to die? Just live. Just be happy that there is nothing coming in the test. You are having a good thing. Your health is becoming more better. Why you are, so eager to find something? And that is a, a well disguised deception that you have to give to the patient. Sometimes the answer should come. You should put a question like this, that the answer should come from inside, awakening the patient. The enlightenment should come from inside. You should put a question like this, then that what will happen if something comes up? And then the patient starts thinking, in a more uh, wider way, or in a more elaborative way about his state. So be rapidly change into healthy state of mind, and with appropriate diet and regimen, seemingly into a healthy state of the body also. So sometimes these psychical remedies, they help us to bring out a patient out of that emotional disease. But the fundamental cause in these cases also is a psoric miasm. We always have to keep this in mind, that if a patient is not letting it go, then somewhere the mental state or the state of mind has become like that, that the psoric miasm has infested that state, which was only not yet quite near its full development. And for security's sake, the seemingly cured patient should be subjected to a radical antipsoric treatment, in order that he may not again, as might easily occur, fall into a similar state of mental disease. So although it is a cure, we feel that he has been cured or she has been cured, but it is seemingly, not really. So we should not take a chance. Even in such cases, we should give them an antipsoric treatment, which basically, whatever their state is at that time, we should give them a constitutional treatment, so that they do not fall into these kind of mental diseases yet again. So in mental and emotional diseases resulting from corporeal maladies, which can only be cured by homeopathic antipsoric medicine conjoined with carefully regulated mode of life, an appropriate psychical behavior toward the patient on the part of those about him and of the physician must be scrupulously observed. So, in addition to the homeopathic medicine, okay, for the real mental diseases, the mental diseases which have resulted from the shift of the physical symptoms to the organ of the mind, with along with the homeopathic medicines, we also have to, it is very important, this part, that we also have to guide the attendants of the patient and the physician. He himself should be aware of this thing, that how he has to behave, or the patient's attendant has to behave around the patient. Because our behavior, sometimes I have seen in many cases where the parents or the attendants, they are not able to understand that how they have to behave, that it can become an obstacle to the cure of the patient. So we have to guide them, especially recently we are having these cases of autism in the children. So we have to guide the patient parents in a way that how they have to be around this child. And sometimes the parents, they do not understand in one time. So we have to guide them again and again and again. We have to keep uh, we have to be observant and keep an eye how they are behaving with the child, so that they can be guided, because they need that kind of guidance. So first we have to be aware how we have to behave. So it should be scrupulously observed, very carefully observed, by way of an auxiliary mental regimen. So it should be a mental regimen, it should be a mental routine which we have to develop. To furious mania, we must oppose calm, intrepidity, and cool. If someone is a maniac, if someone is getting angry, if someone is getting uh, this going into rage, we have to tell ourselves also, we have to train ourselves and tell the attendants also that we must oppose calm and cool behavior around them. We have to be very calm when they are in that state. If the parents or the attendant, they start becoming angry, they will become more angry, it will aggravate them. We have to be calm, cool, but of firm resolution. We should not cave in to their anger. We should be firm that this is wrong, what you are doing. But it should be in a calm and cool way, but with firm resolution. We should not cave in. The parents or the this attendants, they should not cave in to that furious mania. To doleful, querulous lamentation, a mute of display of commiseration. If someone is quarrelful, lamenting, continuously complaining about something, continuously being irritable, there should be mute display of commiseration. We should not at all uh, talk with them. We should not look to them. We should not do any kind of gesture. Okay, so a complete ignorance to that kind of patient where they are querulous, where they are, because you say anything, they will pick it up and they will quarrel about it. They will become irritable about it if you say anything. To senseless chattering, a silence not wholly attentive. If someone is chattering, speaking, talking, you should not talk with them. You should not tell them to stop. So complete silence, but not wholly inattentive. You should be attentive towards them, not completely inattentive. Okay, it should be shown in a way that you are not giving attention, but your ears should be toward that, chattering what they are talking about. To disgusting and abominable conduct, and to the conversation of similar character, total inattention. If someone is lascivious, if someone is talking in that way, if someone is doing a conversation or a conduct like that, there should be a total inattention towards that person. No, not even looking, not even talking, no, complete inattention. So we must merely endeavor to prevent the destruction and injury of surrounding objects. Okay, so the endeavor should be to prevent the destruction and injury of the patient, of the attendants, or the surrounding things, without reproaching the patient for his acts. While we should not at all reproach patient for what he or she is doing, because they are not in their senses. And if we reproach them, if we somehow try to punish them, or somehow try to make them understand in the way we understand, it is going to aggravate everything. And everything must be arranged in such a way that the necessity for any corporeal punishments and tortures, whatever, may be avoided. Even in the clinic, we should not keep things which can harm such kind of patients, which can be broken, or some kind of injury may be conducted to the doctor, to the attendant. So if you know that some kind of patient which is like this, like I have a girl of 18 or 19 years, when she comes into the clinic or when the parents are calling, so I tell everyone, just remove these things, just remove them. So we have to be very proactive in understanding what these patients are suffering from, what the attendants are suffering from. We have to guide the attendants and the parents how they have to behave so that the patient does not become aggravated more. This is so much the more easily affected because in the administration of the medicine, the only circumstance in which the employment of coercion could be justified in the homeopathic system, the sorry, so this is so much the more easily affected because in the administration of the medicine, the only circumstance in which the employment of coercion could be justified. So Dr. Hahnemann is saying that the only circumstance in which coercion means, we have to do against the wishes of the patient, we have to do something against the wishes of the patient is giving the medicine. If the patient is not taking the medicine, only at that time the coercion is justified. The employment of coercion or that this thing is justified because in the administration, only in the administration of the medicine. In the homeopathic system, the small doses of the appropriate medicine never offend the taste because it is small taste. So Dr. Hahnemann was so careful. Sometimes some things which he has written, when you read, you can see that deep state of sympathy and compassion of Dr. Hahnemann, that he is even telling us that, even the taste should not be offended of the patient while giving the medicine. He was going to that uh, level of compassion where he's thinking about a patient who is suffering from a mental disease, and he's thinking of in a term of sympathy that you should not do any punishment or coercion with such a patient. Even homeopathic medicine, they don't offend the taste of the patient because that is also kind of coercion, or that is also kind of torture to offend the taste of such patient, and may consequently be given to the patient without his knowledge and his drinks, so that all compulsion is unnecessary. So even don't coerce for taking medicine, just give the medicine in some drink of his without their knowledge, so that any kind of compulsion is unnecessary. Don't compel the patient to do anything. So sympathetic, so compassionate. uh, you know you can see the personality of a person from his words, that he know that what kind of disease these patients are suffering. He was horrified by the idea that these patients have been taken away from the society and put into those madhouses, into those centers where they are tortured, where they are not taken care as a human being. They have been left on their fate and no medicine is being given to them. He's so much concerned about such patients because that is a heart, or that is a soul from where the homeopathy has originated. And that is why I always say that we can never understand homeopathy if we don't have that kind of heart, or that kind of compassion or sympathy in our being, which is required to understand homeopathy. Because homeopathy is not some practical system, it has to be felt. The whole system was developed, the whole system was discovered out of this feeling which Dr. Hahnemann had towards patient, that whenever I give my medicine, the allopathic medicine, to the patient, they are more suffering. So he stopped his practice. Such great compassion that he has stopped, he has thrown away his practice because his patients were, because he would leave his patients worse after giving the medicine than before he found them. So that is from where this homeopathy has been discovered. We have to uh, get in touch, get in tune with this feeling of homeopathy, and then it starts coming on its own. Then you don't have to put much effort. So footnote to aphorism 228, it is impossible not to marvel at the the same thing. It is impossible not to marvel at the hard-heartedness and indiscretion of the medical men in many establishments for patients of this kind, not only in England but also in Germany, who, without attempting to discover the true and only efficacious mode of curing such diseases, which is why the homeopathic medicinal antisoric means content themselves with torturing these most pitiable. Again, the way he felt pity for those patients. Of all human beings, without the most violent blows and other painful torments. By this unconscientious and revolting procedure, they debase themselves beneath the level of turnkeys in a house of correction, for the later inflict such chastisements at the duty devolving on their office and on criminals only, whilst the former appear from a humiliating consciousness of their uselessness as physicians. So he's saying that it is, how can the people be so hard hearted? The people of medicine, the people who call themselves medical men, they are in these kind of establishments in England, in Germany, other places, and they are so hard hearted that just because they do not want to give this efficacious mode of homeopathic treatment to those patients, they use torments, they use violent blows, they will beat them up, they will use other painful torments to treat these patients, these pitiable of all human beings. Because other diseased human beings, they are at least in their conscious level, they can understand what is right, what is wrong. These patients, they are not able to understand, they are the most pitiable of all those. And those houses, those establishments, they were torturing them, they were beating them, they were using electric shocks on them, they were using other procedures. Like I have studied about uh, a way of surgery where they will put a scalpel and they will remove, they will just erode the forebrain, they will injure the forebrain of the such patients, and they will be like a vegetable for their whole life. So even those kind of unhuman treatments were given to those patients. So he's saying that they are just like the people who are at correction centers in the this prisons. But the only difference is that there is a duty of an officer, and they are treating like that with the criminals. But here, a physician is doing this thing because of his uselessness. What is the usefulness of a physician? That a physician should be able to cure a patient. If he is not able to cure a patient, then this is not the way how they should treat their patients, only to vent their spite at the apparent incurability of mental diseases in harshness towards the pitiable innocent sufferers. So he's saying that just to vent their spite, just to vent their resentment, that they are not able to do anything for these patients, they will harm them. They'll be harsh towards them. Though they are the innocent sufferers, those patients, and they are punishing them, they are beating them, for they are too ignorant to be of any use and too indolent to adopt a judicious mode of treatment. So, on the other hand, contradiction, eager explanations, rude corrections, and invectives, as also weak, timorous yielding, are quite out of place with such patients. So, these things should never be done with such patients. We should not be eagerly explaining them, contradicting them, rude corrections, rudely speaking with them, trying to correct them, or some kind of physical means. And also, we should not be yielding or, be weak in front of them. There should be firmness, but there should be ignorance also. They are equally pernicious modes of treating mental and emotional diseases. They are very dangerous modes of treating these kind of maladies or these kind of diseases. But such patients are most of all aggravated, and their complaint aggravated by contumely, fraud, and deception that they can detect. These patients, they are not incapacitated to detect some kind of fraud or deception. They know that you are telling a lie, or someone is telling a lie, or someone is trying to fraud them or deceive them. Especially the schizophrenic patients, or they are very suspicious already, so they can make out if someone is doing something with them. The physician and keeper must always pretend to believe them to be possessed of reason. So we have to pretend that they are possessed of reason. The physician and the attendant, they should always pretend that yes, we believe in you. Okay, so when they're telling something, you should not deny it. Just be a little inattentive. Keep writing whatever they are saying. Just be inattentive. Don't ask them more. Let them be what they want to tell. But don't, kind of contradict them or try to reason with them. All kinds of external disturbing influences on their senses and dispositions should be, if possible, removed. Any kind of senses, any kind of disturbances which can be strong for them, any kind of influences, they should be removed. There are no amusements for their clouded spirit, no salutary distractions, no means of instruction, no soothing effects from conversation, books or other things for the soul that pines or frets in the chains of diseased body. They should not be given any books to read. Nowadays, I always tell them that don't let them see news, YouTube. Don't let them surf the internet, because they will that becomes the same thing. That is a disturbing influence for them. If someone, uh, like for example, I have told you about a case of Lekises who used to have, this kind of, who would hear sounds that someone is planning some attack on the country or planning to harm someone, and he will go to the police, he will tell to the, other institution that I can hear them conspiring. So if a YouTube is given to such a patient and he starts listening to the conspiracy theories, then that would make his mind more solid that he whatever is happening is right. So these patients, they should not be given any kind of disturbing influence, anything, any kind of thought or thought provoking thing. They should never be given. If a person is religious or he has gone into a religious mania, he should not be given more religious books or more religious instructions or more religious this thing. No, that is going to aggravate him. Okay, because Dr. Hanuman said that for the it is a soul that pines or frets in the chains of a diseased body. It is like that they are chained in this diseased body, and all these things, they are going to get aggravated. No invigoration for it, but the care. We should just care it for them, but not, should not give anything which can invigorate them, which can get them excited. It is only when the bodily health is changed for the better that the tranquility and comfort again beam upon their mind. Only when they start becoming healthy in their body, the tranquility or comfort will come only at that time. So the patients, the attendants, the parents should be told not to do such things. We also should not advise such things, because it is not going to help. On the contrary, it is going to. I never tell such kind of patients or their attendants. Recently, one of such patients' parents, they told me, you should advise him to, meditate. And never tell him to meditate. He can even get this mania of meditation, and it will be more difficult to cure. Then it will be more difficult, you know because that reason is absent. When I tell some healthier person that you should meditate, he will meditate because of reason. There is reasoning that why I should meditate. It is going to calm me. It is, I will be more in control of myself. I will more be in control of, this thing. Sometimes the people who meditate, it increases their ego. It increases their already diseased ego haughtiness, and they may go into some kind of veratrum kind of manias or sulfur kind of manias. So never advise to listen to something, never advise them for some kind of motivation, never advise them for some kind of meditation at that time. We have to understand this thing, that the reasoning is not there. Emotional diseases, yes, these things can help, like we have talked. Or there is some um, uh, behavior which has developed from faulty education, from the surroundings, yes, these things can help. Some motivation can help, some meditation, listening to something, these can help at that time, but not in such cases. So as a physician, we have to first differentiate which case is which, and then we have to advise accordingly. So if the antisoric remedy is selected for each particular case of mental or emotional disease, there are incredibly numerous varieties of them. So we have numerous varieties of antisoric remedies. We have homeopathic remedies. Be quite homeopathically suited for the faithfully traced picture of the morbid state, which, if there be a sufficient number of this kind of medicines, known in respect of their pure effects, is attained by an indefatigable search for the most appropriate homeopathic remedy, all the more easily as the emotional and mental state constituting the principal symptom of such a patient is so unmistakably perceptible. So, among all the antisoric remedies which are known to us, we have to faithfully trace the picture of this state, the characteristic of the principal symptom of the mind, and then we have to find, or we have to search for that remedy which is appropriate homeopathic remedy, which is homeopathically suited to this case. Then the most striking improvement in no very long time, which could not be brought about by physicking the patient to, sorry, I think there is something. Let me check. 30. Okay. Yeah. So we, if we find such a remedy, we will find a striking improvement in no very long time. Okay. In very small time, we can see striking improvement in the behavior, in the emotional part, in the mental part of that patient, which could not be bring up by the off repeated of all other unsuitable allopathic medicines. The medicines which were taking him towards death, the patient towards the death, because of the by numbing his brain, by sedating his brain. So it was taking patient towards the death, and you can see the improvement when it, the patient, although they are on these sedatives, when they come to us nowadays, they're already taking some psychiatric medicine, they are already taking some sedatives. But when you give a right remedy, a right homeopathic remedy to that patient, the kind of difference that remedy brings in the patient has not seen, or the attendants have not seen in, from the years which the allopathic medicine he they were taking. Okay. So the allopathic medicine, it was managing the patient by benumbing or sedating. But that kind of love towards life, or the reasoning, or that intellect which suddenly develops after the right homeopathic remedy, they have not seen in past many, many years in the patient. So that is a beautiful picture to see when the attendants of such patients come. Like I have seen these cases. I have seen the mother. I can, because those are the experiences. I still remember that mother of a boy, 19 20 years old boy, who was, who was tried 2 to 3 times to commit suicide, and he was in a very, very bad state of mind, and he did not like himself. He was so much, kind of disgusted by himself. And they were giving him antidepressants, they were giving him, all those medicines. And after one single dose of Cilicia 10 after 1 month, the mother, she cried, and she was so happy. And the words were that I got my son back after 5 years. These were her words, that my son is back. She said that it is as if, your son was lost somewhere and suddenly he came back home. So that, even in that boy from past 5 years, the medicines, the allopathic medicine, they were managing him, not He was not pushing himself to that part, although those thoughts will come. But the prevailing of the sanity, coming back of reason, coming back of that love of life, that I want to live, that is an amazing, which cannot be described in words. It has to be felt. It is amazing. So, this thing where now you read it with that kind of experience, then you get it. Yes, it is a very beautiful thing which Dr. Hahnemann has written here, that although these patients have been taken medicines from a long time and they were getting more bad in their health, and suddenly with that kind of thing a striking improvement comes. Striking. It strikes you, it strikes the patient, it strikes the um, parents, the attendants of the patient. It strikes you. Indeed, I can confidently assert from great experience that the vast superiority of the homeopathic system over all other conceivable methods of treatment is nowhere displayed in a more triumphant light than in mental and emotional diseases of long standing, which originally sprang from corporeal maladies or were developed simultaneously with them. So he's saying that from Dr. Hahnemann is saying that from my experience, I can say that in this particular aspect of the mental diseases, of the emotional diseases, there is no superior medicinal system which can show or display the triumph, the win, or the cure as the homeopathic system can show. And Dr. Hahnemann's experience have become my experience. And when it becomes your experience, in some of you have experienced this thing, some who have not, when it becomes your experience, especially in such cases, you will be on a completely another level. And then you come back and read the aphorism 230 again, and then you can feel that yes, all these words are true. Because I always say that the right belief, the belief system are of two, uh, you can say, there is believing, and then there is a faith. Faith is next level. Faith comes from experience. Believing is okay, he is believing, that is believing, 5 or 10% are believing, there might be something to believe, that is believing. But faith comes with experience. When you see that happening in front of you, then the faith comes, which cannot go away. Then it can never go away. Whatever anyone says, whatever happens, that faith cannot go away. Belief, it can go anywhere. Today you are believing, tomorrow you might not be believing if you get to listen to something which is quite opposite. That is with the belief. But faith has to come from that experience. It has to come with a feeling. Feeling can only come with an experience. Then the faith sets in. And once you see that thing happening, you will be, uh, you know, every word of this aphorism will feel true. It will feel completely true with your being. Okay. So we have done till aphorism 230. There is a small, this thing to differentiate. You can take I can make it, let me see if I can get it on a whole screen. You can take a screenshot if you want. So these are the types, three types of the diseases. The physical diseases advancing and transferring to the organ of mind. Okay, when the physical diseases or the symptoms are shifting or transferring to the organ of the mind. Then the acutely manifested mental diseases, and the third are mental diseases developed out of circumstantial and situational causes, faults of education, wrongs, vexations, corrupt morals, or some kind of uh, grief, anxiety, all that kind. There is a fourth type I have not added, but maybe you can type, where the emotional disease, they start affecting the physical health, but they will come in the fourth, and this third part is the same. So treatment, proper constitutional similimum antisoric is required. In acute one, the acute manifestation is to be treated first. After the attack subsides, immediately antisoric should be given. Usually subside by psychical and moral remedies like friendly interference, comforting, reasoning, sensible advice, but afterwards should be given a constitutional similimum. Causation is all Sora. They are all caused by Sora. Okay. So we have done 10 aphorisms today, and we'll take a leave. I will take a leave uh, from you at this time. Uh, like again, I will tell you that during the week, go through these 10 aphorisms. If you have been practicing from a long time, try to recall those patients, those experiences. If you have seen cases like these, just try to get in feel with these words. Words are only words until and unless they provoke a thought process in you. I have been talking from 1 hour. Whatever I am saying, these are only words. But these words, they become helpful when they provoke a feeling and a thought process in a person. Then they become meaningful. Until then, they do not have any meaning. They are just words written in some book, kept on a shelf, kept on a table for many, many years. So just go and read them and feel how you feel about them. Hold on to that feeling. Like I told you in the words, when you read them, what Dr. Hahnemann has written, it produces that feeling of compassion and sympathy towards these kind of patients. That is important. A physician without a heart is not a physician. Is just like some machine which has been working from 35 years, 40 years. The heart always tells us to be sympathetic, to love the patients, to listen to them, to be careful with them, to be patient with them when they are telling something, when they are, telling about their even the personal problems. If you have a good heart, you can listen to someone's, because sometimes a person only needs ear. They just want to say something, they just want to tell something, and if you can give your time and your ear to them, just listen to them, they get half cured. They start feeling half. Many patients, they come to the clinic, even most of you also have experienced this. When you listen to them, when they hear to them that catharsis, they start feeling better. They will tell you that, I have come here, I have met you, I have felt very good. So that is what tells you that what is required of a physician. So these words, they amplify that feeling. So again, a request that just during this 1 week, go through them. Next week, next Wednesday, we will start with aphorism 231, and we will start with the intermittent diseases, the alternating diseases or the intermittent diseases, and how we have to go along with them. So till then, thank you, good night, and have a good week. Thank you.